And are we live? All right. Good morning, everybody. It is 10:06 a.m. on November the 4th, 2021. My name is John Belamowicz, Chair of the Texas State Board of Examiners of Psychologists, calling this meeting to order. I'm going to start with roll. Mr. Adler.
I'm here.
Dr. Becker.
Present.
Mr. Bridges.
Good.
Dr. Calhoun.
Here.
Dr. Cartwright.
Here.
Dr. Lambden.
Present.
Dr. Singh.
Here, here, I'm sorry. My throat got, I said, here.
Very, very present. And Mr. Zaguris.
Here.
Very good. Thank you, everybody, for being here. We have a quorum with 100% attendance, and so that is very appreciated. I'm going to take one thing out of order with the chair's report. Wanted to welcome our two newest members, Dr. Lambden and Dr. Cartwright. Congratulations on your appointment. Look forward to working with you. I think I speak for the whole board saying welcome, and I am looking forward to meeting you in person here, hopefully very soon. I'm down here at Ground Zero in Austin with the staff, and there's actually a couple of staff who have joined. They said it's nice to meet you in person for the first time. We haven't met before, so Zoom has been more personal than I thought it would be, but I am looking forward to meeting y'all in person. And I also just want to take a minute to recognize and thank Dr. Ron Palomars and Dr. Susan Fletcher for their service. They have been tremendous additions to the board. They have been, I have so enjoyed all of the conversations that I've had with them, both in the meetings and out, and their absence on this board will be felt greatly. And I just want to call out, just very publicly acknowledge them and thank them for their dedication. They always brought 110% of their passion and their knowledge and expertise to this board, and it's noted, appreciated, and their absence will be felt. So with that, we're going to go ahead and jump into public comment. There were some questions if we were going to, sometimes we've taken public comment later. Sometimes we've taken it closer to the action item that we're going to take. I understand there is a fair amount of comment that we have to get through today. So with that in mind, respectful of everybody's time, we decided to do that early. I decided to do that now so that if anybody who wanted to speak can, so we didn't have to wait, or nobody had to wait around until 3 o'clock or whenever this meeting is going to be done. Hopefully we can get through it quicker than that. So that being said, 3 minutes is the limit. I think we have a lot of it. So respectful of everybody's time. My first boss taught me the adage, be good, be brief, be gone. Now, we don't need anybody to be gone, but being good and being brief, if you can do it in less than 3 minutes and make a point, it will be appreciated, just due to the volume that I'm expecting to see today. But that time is yours, and we're here to hear it. So with that, we will jump into public comment. And I don't know how to run this, so.
That's fine.
You got it?
Yes.
Okay.
All right. We do not have any public attendees here in the office. So we're going to start by those with raised hands.
Oh, and real quick, Mr. Hyde is going to be our timekeeper, and he'll be giving a visual like 1, 2, and then he'll give you an audible 30-second warning, which would be your cue to begin wrapping up.
Ms. Martin.
Yes, can you hear me?
Yes, we can hear you.
Good. Good morning, board members and chairman of the board and so on. I won't take up but a small space of your time because I am governmental liaison for Christian Counselors of Texas, and that organization is just getting to know you. So we'll let the others speak who have more to say. I have more to hear than to say this morning. So just want to thank you for your service in this way. Tell you that we appreciate you, and we will be tuning in, and we are looking for a stakeholder in the psychology board to regularly be with you, hear you, listen to you, and comment. We haven't found the right person yet, but we're looking. So again, thank you for being willing to give of your time, and we'll be learning who you are and how you work. Thank you.
Thank you. And again, just a quick reminder for everybody, when you begin your comment, if you can state your name for the record, please.
Ms. LaCritz.
Good morning. I'm Dr. Laura LaCritz, a psychologist at UT Southwestern Medical Center, a licensed psychologist in Texas, and I've been involved with doctoral and postdoctoral training in psychology for over 25 years. I'm also a former Texas State Board of Psychology oral examiner. I am calling in today to voice my opposition to the proposed changes in Rule 463.11. The pre-doctoral internship is an essential part of preparing future psychologists to be competent to practice. Those of us that have been involved with training know how much time and effort goes into helping to prepare these future psychologists. And without that type of supervised training at that level, Texas may license individuals who are not only ill-equipped to provide that type of quality mental health care, but could also end up being a danger to the public, which I think is extremely important to point out. Thus, this proposed rule not only creates disparity in the quality of licensed psychologists in Texas, but also puts Texans at risk of receiving inadequate mental health care. So again, I'm opposed to the proposed changes to Rule 463.11 and appreciate the opportunity to speak with you today. Thank you so much.
Thank you.
Ms. McGee.
Good morning. My name is Jessica McGee, and I am the Executive Director of TPA, here to talk about Rule 463.11. Some of you know I came here from the Capitol. Over there, there's something quietly referred to as the Rule of Three. Former State Representative Cindy Burkett used to tell her staff that if 3 constituents called with complaints about the same issue or statute, she wanted to know about it. Her theory was that if 3 of her constituents had this problem, so did other legislators, and it was an effective tool. She would go into a hearing on a bill she'd filed to address whatever problem, and she'd bring with her as many examples as her staff could get from other offices. So why do I mention the Rule of Three here? Because TSBEP doesn't have a Rule of Three problem. This is a Rule of One. As recent as Friday in the Lunch and Learn, Mr. Spink said he wants a way to respond to individuals who have gaps in their applications. Not the same gap over and over, not addressing a rule that's poorly written or confusing or that countless applicants have lodged complaints against. He is suggesting hand-holding individuals we're meant to trust to treat the mental health of Texans. However, at that same meeting on Friday, Mr. Spinks also noted that licensees were responsible for knowing board rules. He was adamant and fairly unsympathetic, saying that they were clearly posted on the website. So what was he referring to? The accuracy of mailing addresses. Why is that same accountability not required for something as important as supervisory training? To test this website theory that if it's good enough to be stated on a website, our staff went to the website of the program your applicant attended. And within 30 seconds, they found in clear writing that the program did not provide a pre-doctoral internship of which was required under current law. So how does TSBEP propose to waive this rule, but demand an accurate address? And when did it become good governance to write rules for an individual rather than the whole? Mr. Spinks acknowledged that exact concern Friday when he said exceptions can swallow the rules, and we agree. Finally, as I talk about individual applicants, I'd also like to point out that Texas's workforce shortage will not be addressed on a case-by-case basis. TSBEP and BHAC have spent the last 2 months discussing a rule that immediately upon adoption will impact one provider, a person who is already duly licensed. Instead of one-offs, may I suggest that what you could have done during the last 2 months is promoting to every Texan in need of a mental health provider that 3,500 more psychologists can now practice in Texas as a result of PsyPAC. That is a number that changes the shortage, and that is something the board has already done for Texans. Thank you for your time.
Thank you.
Francis Douglas.
Good morning, board members. Thank you for giving me the opportunity to speak. My name is Frances Douglas. I am the current president of the Texas Psychological Association, and I'm speaking on behalf of myself as well as the association. As you've just heard from Mrs. McGee, we are opposed to proposed rule 463.11. Our primary concern is that this rule would contribute to the erosion of standards for psychologists in Texas and would violate the board's responsibility to protect the public. The rule would give an applicant for licensure who did not qualify due to failure to meet the criteria for supervised experience the right to petition for licensure despite the deficiencies. National training and experience standards for psychologists exist for the purpose of ensuring basic competency for entry-level psychologists. Having these established standards readily available negates the need for individual boards to reinvent the wheel and establish their own subjective standards for determining a basic level of competency. The formal internship, as you've heard, is viewed by psychologists as a crucial safeguard for ensuring that psychology is practiced by competent entry-level professionals. Waiving required aspects of the recognized formal training will simply degrade the standards of profession. The ramifications of Texas being pegged as the state where substandard training and experience is rewarded with licensure is unpleasant to think about. We fear that this will dissuade competent professionals from practicing in Texas while serving as an invitation to the unqualified to apply. The result will be a psychology workforce that is inferior to national standards and ill-trained to care for Texans. I have been attending TSBEB and BHEC meetings for some time, and I'm aware that BHEC aspires to serve as a model to other states. I do not think that eroding the entry-level competency standards will be viewed as exemplary by any behavioral healthcare professionals in the country, but rather as a failure to fulfill the board's mission to effectively regulate the profession and protect the public. And I ask that you reconsider and vote no on this proposed rule. Thank you.
Thank you.
B. Lockhart, do you have a public comment? You need to unmute your phone to speak.
Sorry, thank you. So my name is Dr. L. Lockhart. I'm the past president of the Fort Worth Area Psychological Association. And I'm here to speak against the rule change for 46311. And I just want to remind or speak to the APA requirements that is for training, as well as the APA ethics rules and code of conduct that every psychologist agrees to meet when they become a psychologist. This requires that all psychologists follow the training guidelines for which the internship is under that requirement. In the Texas State Board has adopted the APA format for internship. Taking one person or a few people and saying that it's okay for them not to follow the APA guidelines does not protect the public. APA has created these guidelines and these code of ethics for a reason, and that is to protect the public, to make sure that psychologists are trained to the fullest extent possible to provide appropriate services to clients and patients. This particular applicant does not need to become a licensed psychologist to do what she has already been doing for the last few years. She does not need to be a licensed psychologist to teach at the at the university level. She can do that without being licensed. This board is here to protect the public, as I said, and has already changed the rules for postdoc postdoctoral training and that which runs opposed to the APA guidelines. And which this would further water down the requirements for the internship. Again, I hope that you will vote against this rule change and continue to protect the public and allow psychologists to provide the services that they have studied to provide in their most expert format. Thank you.
Valerie Laura, you have a public comment?
Hi, my name is Dr. Lore, and I'm a licensed psychologist in Texas, and I'm opposed to the proposed changes to Rule 463.11. And I also have my psychology intern here to speak to.
Hi there, my name is Blake Martin. I'm a PhD student in clinical psychology here in the state of Texas, and I'm also opposed to the proposed change to Rule 463.11.
Thank you for allowing us to speak.
Ms. Thomas, do you have a public comment?
Yes, thank you, Ms. Moore. My name is Dr. Joycelyn Williams Thomas. I'm a licensed psychologist in Fort Worth, Texas. I am here today to express my opposition to the proposed rule, the change to Rule 463.11. I completely agree with what's been said already by Ms. McGee and Dr. Douglas, Dr. Fran. I want to talk to you as a psychologist, person of color, and just to talk personally to you. This violates the standard of training. I received my license in 2012. I went to the University of Houston. I had a tough time getting an internship because I had a lot of responsibilities going on in my life, and I needed something that would keep me in Houston. But I'm thankful that my trainers, and that the university said, no, I couldn't get licensed if I created something that didn't meet the standard. I persisted, I stayed with it. I got an APIC pre-doctoral internship at the San Antonio State Hospital, and I'm thankful for it. The fact that there were multiple psychologists there to supervise, it gave me someone to talk to. In fact, there was something I needed to report about what was going on at the hospital. And I had someone else to staff it with, that there were other students there with me who I could talk to. There's a reason why these standards are there and why it's important. And I'm glad I went through that process. To take that away at this point would show the disingenuousness of this process. That this is a standard that is for everyone, that definitely protects the public. I am a better psychologist because I went through it. The standard, the quality of someone's ability to do their work is not the issue. The current person who's going to come before the board, if I said the same thing, I didn't really want to be a psychologist, so I just did the bare minimum of an internship to get through my doctoral program. And then after the fact, I want to come back and say, now co-sign that for me and let me go through. I would not have been approved. I would not have been approved. And this rule change would not be presented today. I ask you, please reconsider and do not approve or change to Rule 463.11. And I thank you for this time.
Thank you. Ms. Grotrues?
Yes, thank you, Ms. Moore. My name is Dr. Carol Grothues. I am a licensed psychologist and member of TPA and chair of the TSBEP monitoring committee. And I have spoken with you before about this rule, and I don't want to repeat myself. I do want to welcome the new board members, Dr. Cartwright and Dr. Lambden, and congratulate Mr. Belemowitz for being reappointed. You're in the midst of a very heated argument regarding this rule change. And basically what it boils down to is that we already have an exception for allowing people retraining to get appropriately retrained. And this rule actually allows an exception to that exception. It's becoming a very slippery slope. And even Mr. Spink so eloquently spoke last Friday saying that the exceptions are going to swallow the rules. And at that point, this board is no longer going to be a viable enforceable agency if every time you get to waive your rules. I was actually very concerned at the last meeting when an LPA applicant that clearly did not meet the rules for meeting even the most basic requirement in research and statistics, that was overlooked. That was considered non-essential, right? Except for the psychologists on the board who voted against it. And they were not listened to. They were not giving any credibility about this. So it's hard to trust that the board is going to make good decisions on an arbitrary case-by-case basis when they've in fact proven that that was not the case. In this situation alone, it is clear that Dr. Stanley did not meet an internship, a formal internship requirement at all, but was rather a preceptorship or a practicum. Right? I appreciate that she is trying to find a way to get licensure, but that the rules are very clear in that. And it's surprising to me that we don't see that as, when we write clear rules, that's the fairest thing that we can do to help people get licensed, not to change that. So I urge the board to reconsider this proposal to allow for even more exceptions and to make this an arbitrary rule enforcing agency. Thank you.
Thank you.
Michael Flynn, do you have a public comment?
Yes, hello, can you hear me?
Yes, we can.
Hello, I'm Michael Flynn. I am a Fort Worth attorney and psychologist. I often represent and have represented, so I'm just going to say psychologists who are trying to get licensed. I guess technically they're not psychologists if they're not licensed, applicants for a psychology license. I've heard the discussion of the rule and the concern that it eliminates an internship. And I appreciate that internship and postdoctoral supervised training are very important. And I believe that the board also appreciates the importance of predoctoral and postdoctoral supervised experience. I don't share my psychology colleagues' concerns that the rule actually eliminates the requirement. What I do believe about the rule is that it allows the board a little bit more flexibility. I've represented applicants whose training was not necessarily traditional or usual, but who in fact had received sufficient training. And I'm going to place a trust in the board and suggest that the rule actually gives the board some flexibility to allow people who are properly trained and adequately trained another avenue. So actually, despite the general opinions being shared, I don't think Rule 460, the change to 463.11 is a problem. I support the rule as an attorney representing applicants and as a psychologist who went through all the hoops. I jumped through all the hoops years ago, but I think the rule is potentially a good rule and provides some benefits to the citizens of the state and also to well-educated people, well-trained people who are seeking licensure and who did not have all the I's crossed and T's dotted that we like to see. So I believe the rule is just fine and I would support it. And that's all I need to say. Thank you. Thank you for this opportunity.
Thank you for your comment. Megan Mooney, do you have a public comment?
Good morning. My name is Dr. Megan Mooney. My pronouns are she, her, and hers. I'm former president of TPA and a licensed psychologist in private practice in Houston. I'm here speaking on behalf of myself. I'll be brief. I echo the concerns and object to the rule change for 463.11. I believe this represents a dangerous change to protection of public from the board. I'm also clinical faculty for 2 different psychology training programs in the Houston area. And as somebody who speaks regularly with interns and postdocs in psychology, I already have a difficult time talking with them about why it makes sense to stay in Texas, why it makes sense to be a psychologist in Texas when we keep eroding the standards for our profession. So I urge you on the basis of protection of the public and protection of our profession not to vote in favor of this rule change for 463.11. Thank you so much for your time.
Thank you. Jeff Baker, do you have a public comment?
Yes, I do. Good morning, everyone. My name is Dr. Jeff Baker. I'm a psychologist licensed here in Texas and also provide clinical services at the University of Texas Medical Branch in Galveston. But I also serve as the executive director for the Association of Psychology Postdoctoral and Internship Centers, called APIC. I have served as chair of the Commission on Accreditation for the American Psychological Association, and I've also served for 6 years on the Texas State Board of Examiners of Psychologists. I'm very familiar with the complaint process and the enforcement issues. I appreciate the work that the board does. I would never vote for this rule change. This is not going to be helpful to the board, not going to be protective of the public. It's going to cause a significant amount of difficulties for both the board and for trainees. And all due respect to Dr. Flynn, I'm afraid this will increase your caseload, Dr. Flynn, but maybe that's what you would like. And I don't think this is a good, wise move to do to change the rule 463.11. There are many concerns out there, but when you're getting letters from the APIC, the Association of Psychology Internships, which has 790 internships in the US, 36 internships in Texas, that this is a great idea. And if you're getting letters from the American Psychological Association opposed to this rule, or the Association of State and Provincial Psychology Boards opposed to this rule, I think that it really takes another look at this rule change. And I do appreciate your time. And thank you very much. Glad to answer questions if anything comes up.
I'd like to just say this is the time for the public to address the board. This is really not a time to go back and forth between other public commenters. So if we can keep comments directed at the board, it would be appreciated. Thank you.
Alice Holland, do you have a public comment?
Yes, I do. Thank you. Let's see. My name is Allison Holland. I see many familiar faces in the room. First of all, I just want to thank you all for giving me time to speak today. I'm a past president of TPA, and I'm involved in clinical training at UT Southwestern. I'm here today to express my opposition to the proposed changes to 463.11. I fail to understand why we would allow exceptions to licensure standards rather than asking individuals to complete very basic requirements, such as a formally structured internship. An internship is designed as an educational experience. It's not the same thing as a year working under variable degrees of supervision. To those of you who are PhDs, I ask you to consider what the value of your status as a licensed psychologist may become if this rule moves forward. For the most part, members of the general public are not capable of accurately assessing the quality of a psychologist training, nor should they be expected to be. This is an essential reason for licensure standards to remain consistent across all applicants. Allowing case-by-case exceptions then places the burden of assessing a psychologist's qualifications on the consumer, which is not only inappropriate, but also potentially harmful to the general public. To those of you who are master's level professionals or work in other fields, I ask that you respect the standards of licensure as a clinical psychologist, just as you would respect the standards for your own professions. Thank you.
Thank you. Dr. Branneman. Unmute your computer.
There we go.
Here we go.
Good morning. I'm Tim Branneman, and I'm a licensed psychologist in private practice. I'm here to oppose proposed change of rules 463.11, and I'm commenting in my personal capacity as a longtime licensed psychologist, serving also as faculty in a clinical psychology training program. And also from my nearly 13 years of experience with this board, most of that as chair. I would say, unlike some degree of supervision in private practice, an internship is a structured learning experience as a member of a cohort of students receiving instruction, as well as hands-on experience in one or more clinical settings. I do understand that the proposed rule change does not do away with the requirement for a structured predoctoral internship. However, while some may believe that that waiver would have little effect, I would say that there's no evidence at all to support or basis to believe that. There are many doctoral level psychology programs that clearly state that they do not train for the purpose of licensure and do not require students to have completed a predoctoral internship. I suggest that such a waiver will open a pathway to Texas licensure that university psychology programs, such as those that I mentioned, will readily market to their own benefit, sending greater numbers to seek licensure in Texas when they cannot do so elsewhere. While I'm not certain for the rationale for the proposed change, I've heard some believe that this regression in standards would provide greater access to mental health services by psychologists in smaller Texas communities. If that is true, this is a supposition with no evidence to support the presumption of such psychologists settling in those communities. Moreover, the rapid evolution of teletherapy has made psychological services generally available even in remote areas of Texas. If it is face-to-face in-office access that is the board's concern, then the presumption must be that citizens of smaller Texas communities do not deserve the same standard of training and quality of services by psychologists who may serve them. While I am aware that the proposed change is well intentioned, I don't believe the unintended consequences of such a change have been fully considered. I know from personal experience while serving as chair of this board, hearing cases that should remind board members of the importance of standards of training that are foundational to the standard of care. I respectfully ask board members to vote no on proposed modification of 463.11 that provides waiver for the required predoctoral internship. Thank you for your time.
Thank you. Aaliyah Cantu, do you have a public comment? You can unmute so we can hear you.
Thank you. I'm sorry, my printer was just printing. My name is Aaliyah Cantu. I'm a licensed psychologist in the state of Texas, and I'm also an early career psychologist. I served in the role of co-president for the Sam Houston Area Psychological Association, or SHAPA, for several years, and we wrote a letter to the board last week on behalf of SHAPA. Today, I want to voice concerns about a potential rule change to 463.11 as written. I agree with the statements provided earlier related to the standards of practice, and have concerns related to deviating from national standards as stated by Dr. Hall and Ms. McGee. However, my concerns today most closely relate to those provided by Dr. Williams-Thomas. Many members of SHAPA are educators. I am also an educator. National standards matter. We require psychologists to meet those standards for licensure in our state because they're important. I'd like to address the developmental needs of trainees. I'm particularly concerned about 3 areas. This waiver as written may undermine the developmental needs of students who are granted this type of exemption. The waiver may diminish the quality of training afforded to these students. And unexpectedly, it could negatively impact the trainee later in their career. Internship offers students a unique experience in a novel treatment setting, not a continuation of practica. During internship, many students have access to clients with more extreme symptom presentation and often higher risk profiles. Therefore, they need more than one supervisor. They may encounter novel ethical dilemmas that are complex and nuanced. Having access to sufficient number of supervisors is necessary for the provision of high quality training. Waiving this rule could diminish their training experience. My own internship was a wonderful year. I happened to be supervised by 5 different board certified forensic psychologists. It was a rich year with a lot of training experiences. I had 3 or 4 rotations. Those who were expertly qualified to supervise me in one rotation were not qualified to supervise me in other aspects of my training. For example, neuropsychology.
Lack of adequate supervision may translate into lack of training opportunities for our students and our future psychologists. I also have concerns that students may not be able to obtain licensure in other states down the road.
30
To
seconds.
obtain a, pardon?
30 seconds.
Oh, thank you. To obtain a quality postdoc or board certification. As an intern, students may not be thinking about their career 10 to 20 years down the road. This can hinder our ability to recruit students, retain students, and keep newly licensed psychologists. Thank you for your time today.
Aisha Nadia.
Can you hear me?
Yes.
There we go. Hello, my name is Aisha Najab. I'm a licensed psychologist and president-elect of the Dallas Psychological Association. I want to thank you for allowing us to speak with you today. I'm calling in to voice my opposition to the rule change that would waive the pre-doctoral internship requirement for licensure. This rule change would lower the standard of mental health care across the state. And certainly we might feel confident in the current board to screen out any poor applicants, but what about the future? Can we really guarantee the same could be said for all future boards? I'm concerned that this sets a precedent of slippery slope of lowering our requirements. Texas should be known for their high standards of care, not known as the state with the lowest standard of training in the United States. No other state has allowed psychologists to be licensed with so little training as this rule proposes. As others have voiced, I'm concerned that the proposed rule change contradicts the national standard of training, and I'm also concerned that the proposed rule, if it is adopted, unqualified applicants seeking licensure could use Texas as a safe haven. We would want to attract the best and brightest, not those seeking to cut corners for a license. This creates a disparity if we're licensing people with lower requirements between the people who have met these lower requirements and then people who have met the national standard. And I really don't think that the average person seeking care would know the difference between these two. So I really feel like it puts Texans at greater risk for receiving inadequate mental health care. I would urge you, please, to vote no on this. Thank you.
Thank you. Cynthia Palmer, do you have a public comment?
Yes, can you hear me?
Yes.
Okay. Hi, thank you for this opportunity to be able to make a public comment. I would like to put in my opposition for Rule 63.11. I'm very concerned that this has even been proposed. It's critical to the integrity of our profession as well as the care of our clients and patients that psychologists are adequately trained and skilled to provide services. So thus having a strong set of requirements helps to ensure that this can occur. By allowing certain individuals to petition to waive some of these core requirements, at risk of allowing an inadequately trained individual to petition to become a psychologist, and puts our profession at risk of not being taken seriously and no longer looked at as experts in the field of mental health due to incompetent and ill-trained professionals. More importantly, inadequately trained psychologists can cause serious harm to clients and patients who are seeking. For the sake of our profession and the health of our clients and patients, we need to continue to enforce a set of standards with no ability to waive out of these core requirements. And also, I am a licensed clinical psychologist. I forgot to introduce myself. I'm a licensed clinical psychologist. I've also worked as a supervisor on several APA accredited internship programs. And I've also been a director of a training clinic. So I am very opposed to this because I think the supervision and experience is extremely important. Thank you for your time to allow me to comment.
Thank you. Katie Sardone, do you have a public comment? You can unmute your mic so we can hear you.
Can you hear me now?
Yes, we can.
Okay, perfect. Sorry about that. I started chatting away.
Not at all.
Good morning. I'm Katie Sardone. I'm a licensed psychologist in Texas and past president of the Dallas Psychological Association. I'm strongly opposed to the proposed changes to Rule 463.11. The proposed rule dilutes an essential training component for future licensed psychologists and is inconsistent with national training and education standards. This proposed change comes on the heels of recent changes made to the postdoctoral training requirements for licensure and the cessation of the oral exam during the last sunset committee just a couple years ago. So I would argue that our training requirements have already been reduced to the bare minimum. There's really no room to reduce requirements. These changes recently made were also made to allow Texas to fall in line with the requirements for PsyPACT, allowing reciprocal licensure in other states. If these changes were made, we would be the first state to adopt such a change, making it so that we no longer fall in line with PsyPACT, which is a concern. I ask that you vote no on this proposed change, and I thank you very much for your time.
Thank you.
Ms. McDonald, do you have a public comment?
Yes, can you hear me?
Yes.
Hi, thank you for your time this morning. My name is Dr. Gracie Reyes McDonald. I am a school psychologist and licensed psychologist in private practice in the Woodlands, Texas. I am here to voice my opposition to Rule 463.11. And just to tell you a little bit about myself, I began as a licensed specialist in school psychology. I completed an internship in school psychology in 2003. And after working in the schools for a few years, I enrolled in the University of Houston School Psychology doctoral program. And in 2012, completed a second internship in school psychology. Yes, I completed 2 internships in school psychology in 2 different school districts. Now, you might think that I would be all for being exempt from a second internship. However, that is not the case. The pre-doctoral internship was a year of learning for me, despite my years of experience in the field. It was great to learn from several supervisors during that pre-doctoral internship year. It was a safe place to apply new skills that I now use in private practice. The supervised pre-doctoral internship year is important for the development of individual clinicians, and therefore is important for the well-being of our clients and the public at large. In addition, from my understanding, there already is a provision for special cases that may warrant a waiver in regards to supervised experience that is accessible to the board, that there already is a waiver available. So the need for a special rule for Rule 463.11 is superfluous. It is not needed at this time. And therefore, I urge you, the board, to vote against Rule 463.11. Thank you for your time.
Dr. Hal Martin, do you have a public comment?
Yes, I do. Thank you so much for taking the time for this comment and for this meeting this morning. My name is Laura Hal Martin. I'm a licensed clinical psychologist, a board certified clinical psychologist, and also a professor who supervises both practicum students and interns. And so I just want to let y'all know that I'm opposed to this rule change to 463.11 at this point. I've worked on local and national levels on various standards for psychologists across the field, primarily in continuing education. But what I've witnessed is that when we start to augment rules based on a case-by-case basis, we actually open ourselves up to increased burden and litigation. Not to mention, we continue to limit protection of the public. I wanted to bring up 2 specific situations that I have encountered, either as a colleague or in training. I've worked in settings across sites and in other states in which I've witnessed 2 individuals who were unable to complete their internships. In each of those cases, allowing those 2 individuals to go forth and get licensed despite opposition of the people who had trained them or just a lack of their training completion would have been very detrimental and actually dangerous to the public. Each of those 2 applicants had completed their necessary graduate coursework, including their dissertation work and basic pre-doctoral competency exam work, but they were unable to complete internship due to their problems meeting very basic ethical
and or other training requirements. So fortunately, to my knowledge, neither are licensed as psychologists in this state or any other state or territory. My concern is that individuals such as this may be allowed in the future to seek exception in a state like Texas. Thank you.
Thank you.
Nayaz Debani, do you have a public comment?
Yes, I do. Thank you for your time. Can you hear me?
We can.
I'm Niaz Debani, Dr. Niaz Debani. I'm a psychologist, licensed psychologist, state of Texas at UT Southwestern Medical Center. And I am also strongly opposed to the proposed changes to Rule 463.11. I have been trained solely in Texas and practiced solely in Texas. And my most influential year was my internship year. Everything I learned was primarily in that year. And like many have said, that was when I was trained and supervised by a number of individuals in different rotations. And I'm actually trained as a neuropsychologist, so I received extra supervision, which I think is needed in our field. And I feel like if this is this rule change goes into effect, we are providing a disservice to our citizens of Texas, and mental health is such an important issue. I feel like it'll water down the national requirements, and I feel like Texas should stay on top of that. So I, again, strongly oppose the changes to Rule 463.11. Thank you all for your time.
Thank you. BPA admin, do you have a public comment?
Hi, yes. Can you hear me?
Yes.
I can.
Hi, my name is Sophia Tani. I'm a psychologist in private practice in College Station, Texas. And I am also the president of the Brazos Valley Psychological Association, representing about 40 psychologists in our geographic area. So we're very much opposed to this proposed change related to supervised experience required for licensure as a psychologist, because members of BVPA are committed to upholding the highest standards for a profession, because we recognize that Texans deserve no less. The public ought to be able to trust that when we see a psychologist, they're getting care from a professional who has undergone not only doctorate level training, but also rigorous supervised experience. Diluting standards of licensure would undermine the public's trust in the licensure system. More importantly, it removes one of the safeguards to the public's interest in ensuring that availability of qualified psychological services. In a national mental health epidemic, is no time to lower the training and licensing standards for psychologists licensed to practice in Texas. So we believe firmly that psychologists' current standards of licensure should not be diminished or diluted. Rather, any clinician wishing to become licensed as a psychologist in Texas should have to raise their standards. Texas lowers its standards for mental health services at its own risk. And unfortunately, it is the most vulnerable among us who pay the price. The only thing worse to our profession than an unqualified practitioner is having one cloaked with the credentials of a licensed professional. Please do not neglect your duty to protect the public and keep psychologists' current standards of licensure intact. We urge the board to reconsider this proposed rule. Thank you very much.
Thank you.
Andrea Wahlberg, do you have a public comment?
Yes, hi, thank you. My name is Andrea Wahlberg. I'm a licensed psychologist in Texas. I practice as a pediatric neuropsychologist at Children's Medical Center in Dallas, and I'm also involved in the training and supervision of psychology interns and fellows. In my direct work training interns, I assure you that the supervised training is an essential component of these students' training, as it allows them to apply the skills that they've learned in their coursework. A clinical internship should be seen as a very, very basic requirement, absolutely essential for later independent practice as a psychologist. Anything less could be detrimental to the mental health of Texans. I'm strongly opposed to the proposed changes to Rule 463.11. Thank you for your time.
Thank you.
Thank you.
Ms. Nyberg, do you have a public comment? Can I unmute your mic, please? Try it one more time.
Hello?
Yes.
Great. I'm Tim Nyberg. I'm a licensed psychologist in primarily forensic practice in Wichita Falls, up on the border with Oklahoma. I am concerned, right, that the rule change will sort of make being a psychologist here in Texas less than, right, what it is to be a psychologist in other places. Living on the border as I do, that's a particular concern. Otherwise, just wanted to sort of voice my opposition to the rules change. Other people have articulated very well what that may do for this state and the general public. I'm opposed to the change.
Thank you.
One second. Monroe Callum, do you have a public comment?
Yes, I do. My name is Monroe Cullum. I'm the Chief of Psychology at UT Southwestern Medical Center. I've been involved in the field of psychology and neuropsychology for well over 30 years in 3 different states. I'm strongly opposed to the proposed rule change for Rule 46311. This would set Texas at the bottom of national, in fact, North American standards. Training in psychology at the highest levels is essential for all the reasons others have mentioned here. I won't belabor the point, but this would be a massive step backwards for our entire state. It would actually discourage people from moving to Texas in order to undergo their training here to become licensed to serve our citizens of the state. So I could not be more opposed to this rule change. Thank you.
There are no further hands raised. One second. Lauren Pasca, you have a public comment?
Yes, I do. My name is Lauren Pasqua. I am a licensed clinical psychologist in Texas. Currently, I provide both clinical care and train future psychologists in my private practice setting. The provisionally licensed psychologists that we hire within our practice currently come in with a very strong skill set and knowledge base as compared to the master's level clinicians that we also train. A major factor, I believe, in this difference is that they have already obtained significant training and supervision during the completion of their internship year. Completing that full year of internship is an integral component to ensure that psychologists in Texas are highly trained and experienced. Currently, the public views licensed psychologists as highly skilled professionals within the mental health sphere as compared to other professionals that we may also hire or work with. The public also, a key factor in attaining the skill level that the public views is that we have undergone extensive supervised clinical experience. I believe by removing the requirement of the internship year, we risk diluting the care offered by our profession and possibly harming the public through inadequate training. I strongly oppose Rule 463.11. Please consider voting no for this amendment.
Let me add something real quick. We've got one more hand up. If you've got a public comment, you need to go ahead and raise your hand so that we don't have stuff continue to trickle in. Because once Dr. Hill is done, unless another hand is raised real quick, that'll be the end of public comment.
Thank you. David Hill, go ahead.
All right, I think I'm unmuted. Can you hear me?
Yes.
Boy, you'd think I'd be able to figure this out by now with all these Zoom meetings over the last couple of years. Good to hear from you, Daryl, and good to see all of you. Welcome to the new board members. You picked a bit of a doozy to come in on. I'm a psychologist, David Hill, psychologist in private practice in Austin. I'm a current board member of Texas Psychological Association and past president of Capital Area Psychological Association. I'm just here to voice my opposition to 463.11 for all the reasons that the other professionals have said. I'd just like to really say, I know I've sat on a number of boards myself, and you come up with ideas that seem really appropriate in the moment, but then you get feedback. And I'd like to suggest, please listen to the feedback of the profession that you're governing. We all have some pretty strong feelings about this exception and where exceptions can lead you in governance of the profession. That's all I got to say. I appreciate your time, and I deeply appreciate your service. I know how difficult it can be. Thank you very much.
Thank you.
We do not have any telephone attendees here. So that concludes our public comment session for today.
Very good. So moving on. So I already did the chair's report, so we're good there. Are you ready to go?
Yeah.
All right, good deal. Turn it over to Ms. Moore.
So the council report, there's no formal report here. There's materials in the packet just for you to review the fourth quarter findings and calculations, and also the annual fiscal year report for the council. And next, the council is launching a new online application module for the psychology applications for licensed psychological associate, licensed specialist in school psychology, and licensed psychologists. So with this in mind, the council will no longer accept paper applications received in the board on or after November the 20th. So therefore, if we do get it, it will be returned to the submitter. User guides will be available on our website to assist applicants on navigating the new online process beginning November the 22nd.
Good.
Diane, is the online process live now?
No, it's
Okay.
for other professions that we govern, but not for the psychology board.
Is the online process going to go live prior to the launch of us not accepting paper applications? Just trying to think through the fact that things don't always go as smoothly as we plan for them to go.
Right.
That I wonder if we want to perhaps have maybe a little bit of overlap time between those two things.
Tim, are you online here with us?
I am.
Okay. Can you chime in on the launch?
When's the online go live, Tim?
It goes live on the 22nd. It is a hard cutoff. There isn't any plan in there about a simultaneous acceptance of online or paper.
Just keep in mind that, we do have user acceptance testing done before we do launch a go live. So there shouldn't be any hiccups. If there are, there should be minor. But we already have other professions that operate under this council that are online for their initial applications. So we don't.
It's not the first time we've done this. So
Okay, if
yeah.
you guys aren't concerned, I won't be concerned.
Yeah, I mean, there will
You know I
always
like to
be
ask questions.
yeah, there will always be a hiccup, but y'all are actually the last ones to do this. So I think we've got a grasp on it. Yeah.
Well, it's new for the psychologist. It's the same system as being used in other professions. It's just a matter of incorporating psychologists at this point. Is that correct?
Yes.
Okay.
Correct.
That's a good question.
Thank you. All right. So moving along here, the council wanted to take a look at, since we eliminated or discontinued the renewal cards, they asked that we put this on the agenda today just to see how many people actually requested a renewal card to be sent to them. And we had a very low number that did request that. Second here, if I can magnify my screen. We had a little under. I can't see it. It's not working. There. Okay. So combined for the LSSP and the licensed psychologists, we only had a little under 400 individuals request a tangible renewal card. But our system, if you use the license verification link, you can verify that information if you renew. You can also log in the licensing portal, and licensees can see that they're renewed once all their information has been processed. The SciPack update, the newsletter is in the packet for viewing, but just to note, there are now 27 enacted states, and there are 23 that are effective. And later this month, around November 23rd, New Jersey will be enacted, and Kansas will be, effective. And Kansas will be effective in January 2022. For the Asppb update, they did hold their annual conference virtually on October the 15th and 16th. The conference was well attended. Some of the topics that they discussed there was the Asppb diagnostic updates, continuing competency, useful tools for regulators and licensees. And Daryl did present a session for closing a practice. Other sessions for tools for regulators were social media guidelines, supervision guidelines, and an Asppb toolkit. And that concludes my report.
Very good. Thank you, Ms. Moore. Enforcement, are y'all ready to go?
Yes, sir.
I want to do that. And maybe after that, we'll take a short break.
Okay.
All right, take it away.
Thank you, sir. First of all, it's good to see all of you, including the new board members. Hello, my name is Alfonso. Nice to meet you all. Going right back into it. First off is the dismissals for the fourth quarter. We had a total of 22, and I'm open to any questions you may have.
Hearing none.
All right.
Dr. Lambdins and Cartwright, we're on page 34 of the book.
Going now to the fourth quarter status report. Again, I'm open to any questions you may have. Dr. Cartwright, you're muted.
Sorry.
Right.
Maybe if you could just give a real quick explanation of this, just so Dr. Lambdin and I know exactly what we're looking at and what we need to be processing in terms of and also what the expectations are. And that's probably in other documents, but since we've just had a few days to review documents, it would be helpful to just kind of get maybe just a quick overview of what we're looking at and what we should be expecting, and if we are kind of in out of that area.
No, well, on these status quarter report, it's a collective numbers of all the pending investigations here under the council. It is broken down a little bit by board, and the second part right there, you can see how many specific for the psych board they are. For that quarter, there were 63 pending. And then it goes back into a collective number for all the boards after that. They're broken down by priority. Priority one being physical harm, sexual misconduct, and applicants. Everything else is a priority 4, and I don't list those. And you can also see how many cases were resolved, either by dismissals or by agreed order. And at the very bottom, you can see how many are still pending by fiscal year.
Alfonso, the number of new complaints received, that's across all boards, or Is that correct?
Yes, sir.
Okay.
Yes. Mhm.
All right, any other questions or discussion?
Is there a particular goal, like a goal for the board that we want to see in terms of these numbers? And again, that may be in other documents, but I apologize if I'm.
We
just
want
not
them to
looking
be
at-
getting smaller. We want them to be being processed faster, and
Right.
that's the constant battle. But Alfonso, I'll let you explain that.
I can tell you you're already doing better than you've ever done historically. The numbers are far better than what TSBP ever had historically on its own. You've only got 63 pending complaints right now. That's the lowest it's ever been since I've been with the board in 11 years. You're in good shape.
And that's
you're in very good shape.
Gerald, that number is across again, all boards, correct?
No, Psych board only has 63 cases pending.
Okay.
Yeah, the LPCs and social work have a lot more. They have a lot bigger licensee population, but they also came over with a pretty significant backlog of cases when the boards were merged.
That was part of hopefully the efficiencies of BHEC though, is to be able to chew through all those numbers and just process them more efficiently. And it there's always room for improvement, but we're doing pretty darn good right now.
Yes, sir.
Is this where we make a motion to give Alfonso a raise?
No.
I second that motion. Now, Mr. Bridges, the attorney here, he's also been very helpful with all this. So it's just not me, and it's also Patrick and his team.
It's all a teamwork.
Yeah.
I think going forward, Alfonso's even going to break it down on the new complaints received. Alfonso, correct me if I'm wrong. Is that something that the council, I think, had requested last meeting? They
Yes,
wanted
sir.
to see a breakdown of all the new complaints coming in, how many are coming in per board. So you'll see that coming in as well. And I can't remember now if they wanted a breakdown of the priority 1, 2, and 3 complaints also. I don't remember. I have to go back and check my notes, but it seems like they asked for that.
Yes, sir. That's the way I remember it.
Okay.
All right.
Do we have any discussion on the ISC panels? They've been going smoothly in the ad hoc fashion we've been doing. I haven't heard any complaints, but if anyone's got any discussion.
I'll just say for the benefit of our new board members. So ISCs, it's informal settlement conferences where we deal with complaints informally and we can examine evidence and talk to the parties involved. And depending on what's there, essentially it tends to be a negotiated thing, and to figure out again how much of a penalty can we get if there is something there, if for whatever the issue might be. When we've done that, sometimes it's taken a minimum of a day, sometimes 2 days before a board meeting, to where we would be here in Austin for up to 3 days doing that. What we've done through Zoom, I mean, we started doing ISCs over Zoom, and then again with the advent of that, it allowed us to be a little bit more flexible, to respond quicker or to isolate, to just jump on and do one case. So that's how we've transitioned it to do on a more ad hoc basis rather than doing the multi-day marathon around the board meeting. It also allows us to actually, when we're ready to address the complaint, we don't have to wait a month or 2 or more to actually address it. So that's kind of the history of how we got to where we are with that. So do we need to put some names down for September through November of 22? Is that correct?
I believe we were going to discuss this go around some sort of new method. Last meeting, that was a push to this meeting. I mean, we can continue as it is, but
what was the new method? Do you remember?
I think there was mention of wanting to bring people in to train them, but the problem we've got is we're already using 3 board members in the actual ISC, and pulling someone in would deplete the pool for final discussion even further.
So
if I remember correctly.
The goal is to get new members up to speed, essentially.
Correct.
So I can speak for myself. I was a lot of times it was two experienced ones and then me when I started out. And so it was easy to pick it up quick and understand what the process was. So perhaps if we rotate in our new members kind of one at a time, where we don't put both of them together, does that achieve the same goal?
If it would help, we could always have a mock session. That way we don't actually deplete anyone's voting ability. We could just set up a fake case and.
Why
I
don't
like
we?
that idea personally, simply because I'm about to do my first one, and we currently have no psychologists on the board who have been through this process currently.
My schedule's open for when we want to schedule. I'm sure Alfonso can volunteer a couple of investigators to serve as victims.
Can you make, Mr. Bridges, can you make a mock video, short video with the important points in it? And just make a mock video with your staff and all that. And just
If you can forgive my lousy acting ability, I'm sure we can throw something together.
and then just send it to us. We have learned during this pandemic how to learn online. So that will be beneficial.
I'll get together with Mr. Fernandez and we'll see what we can't throw together.
I was just going to suggest, Dr. Singh, and Mr. Bridges, you can speak for yourself. I imagine that in terms of labor involved to do that, it wouldn't be that much more work to actually just do it one-on-one and have the benefit of an interactive session over it versus creating a video. I feel like that labor would be about the same, and the result of training might be better because it would be more one-on-one and interactive.
I can do either, whichever works.
Yeah, I would. Everybody learns differently. I learned by doing it, and it wasn't, particularly difficult. And the reality is, I think that everybody, in terms of your skill set and backgrounds and expertise that you bring to the ISC process, there's no training that can get you to the point where you already are, in that regard. And so the best thing that you can do is bring your experience that you already have, because from my perspective, that is what has prepared you to make a judgment call in the ISC process. So trust yourselves.
Well, then people may not be able to attend that one-on-one or that session, mock session online. But if you had the video.
Well, what we can do both.
Yeah.
If someone wants to volunteer, we can do the mock session video, record it, and then that can serve as the video training.
Yeah.
For the others.
Yeah. And this could be even included in the training for the new members in future.
Yeah, it's I guess we can never see.
My concern isn't with the judgment. It's with a lot of things like rolling on the board. It's the procedural stuff and kind of making sure that we all understand sort of what's expected in terms of how things proceed procedurally and what the expectations in what we're supposed to do and how we are supposed to do them and what decisions get made, how they get made, how you rule, things like that are really what I'd want training on, not really like that, how to make the decision piece of it or how to hear it. It's more the procedural things that I'd want to work through.
We're talking about procedures around ISCs. The I of ISC is informal, and I can tell you it's rather informal. People come in and state their case, you listen, you ask questions, you hear the other side, listen, you ask questions. So it's quite informal. It's structured, it's loosely structured in that regard in terms of the turns that people take, but it's love anyone else's input on it. It's just not that formal of a procedural process, the actual going through it.
Most of the, Dr. Becker, most of the procedural is handled by staff, not by the board members.
Yeah.
We handle most of that, setting it up, dictating, who goes first, that kind of stuff all that is really handled by staff. When y'all show up, it's okay, here's the complainant. They give their side, you question them. We do the same thing for the respondent. then y'all debate and discuss what you think what you think the facts are and the outcome ought to be. And then again, that's then taken by staff, and we handle the procedures after that as well.
Herman, I see
There's
you're
not.
Yeah, Dr. Becker, I think the best thing you can do, and you'll get a plethora, it's like any case, like of all the documentation of all it involves. And the best way to prepare for that case is you have to read every single word, but it'll provide you a good basis for what you want to ask or what things you're looking for in terms of the violation, or because sometimes it's kind of like you'll get a bunch of pages of text messages, things like that, whatever. So I think that's, in terms of that, it's just basically, it's not like a formal legal proceeding, but because it's informal, but it's just basically asking questions and wanting your own clarification about what happened, and then using that to decide your own how it should go, or kind of if there's something that should be done in terms of like a penalty or something like that. But it's done as a group, and that's pretty much how it is.
Well, why don't staff put together, we'll do something with, we can do something with Dr. Becker, and we can record that if we all feel like we didn't, say something embarrassing or something goofy on the video. We could use that as kind of the training video going forward.
I just want folks to hear a little bit that this is, by definition, the Texas State Board of Examiners of Psychology. Dr. Singh and I have been on this board for 11 months, and we just rolled on 2 more brand new psychologists.
Yes.
That's your 4 psychology representatives are all less than a year on this board, and not one of us have attended one of these. And I am simply saying that for all of us, we don't know what this process looks like, feels like, sounds like, and we are deciding people's challenges and complaints to the board. And if we are going to take that seriously, and with the intention that the public is bringing those to us, then we need to take that seriously, and we need to take that, even though it is an informal process, then we are charged with seriously being trained and understanding the role in which we are taking that under. So I hear all of the things that you guys are saying, but I also think that is our responsibility to take that on and understand what we are doing and understand what we are endeavoring to be doing when we are sitting in that room. And that is a standardized process by which people are trained to do it. So I think it is a reasonable ask that we know what we are getting into when we walk into that room. And it's not just you'll figure it out when you get there. So that's what I'm asking for here.
Well,
Dr. Becker.
I guess we have all watched so much Judge Judy. So if that's a training, I could handle Judge Judy stuff, but I would like to know some do's and don'ts, and some things maybe written out or through video that I need to be really cognizant of. And I agree with Dr. Becker. We are dealing with people's lives, and we just cannot be too informal. But I told you, I follow Judge Judy's example.
I appreciate all y'all's concern regarding being ethical, and we're worried about the lives that we're affecting. I would say that Mr. Bridges and before him, Mr. Spinks pretty much were giving us the ideas and the concepts that we needed to look at. We used a little bit of our own common sense and logic, but what helped me the most was before we actually were pointed to an ISC, they had us go to 2 different ISCs and just observe. And I don't know if that has changed since pandemic or whatever, but we were invited to the ISC as a, what could I say, spectator, or just watching on. And then we were actually aware of the process and how things would happen. But as far as being able to train somebody on an ISC panel, I mean, there's just so many things that can come in there. You might train for one thing, and then you may never get a case like that ever again. And so you need to be on an open mind thing, you know. I mean, you're going to be getting things thrown at you by the attorneys, by the people that are doing the case, and you basically go with the flow. And the rules and the technical aspect are done by the attorneys. And correct me if I'm wrong, John.
No, that's
Well said, Mr. Zagoras.
I guess it's the same. There was some board training and making sure that we did our paperwork correctly for all of us as we come onto the board. But the things that trained us and prepared us to, you know, do what we do here on the board, that experience didn't come from training here. That experience came from our individual lives and experiences before we got here. And I see ISCs as the same way. If you bring all of your knowledge to that process with your questions, and to Mr. Zaguras's point, I can't recall 2 ISCs that were very similar. I mean, it's the stuff, it's the outside the lines things that that rises to the level of the board having to deal with it. And so they're just all different. The procedural stuff though is it's a far lower bar even than how probably a board meeting is conducted. So even going through this process, I can confidently say that I think everybody will be pretty well prepared, and they're good questions, and it sounds like staff is going to take care of at least where you can see kind of the framework first.
When I do these ISCs, I'm counting on y'all as the experts. You can't be my expert witness if I take this to SOA, but again, as I say, I have a bachelor's in sociology. So I've got a limit, but when we start going into these more complex frameworks and issues, I'm counting on y'all to let me know, is that legit or not legit? Y'all have been in the practice. You know how it actually takes to run a private psychology or work in these organizations or school psychology. So you're my opinion on the street to let me know. So that's what I'm counting on most, and that what y'all are most helpful for.
One example would be like, just for instance, you mentioned penalties. What would, some type of violation, and like what penalty would fall under? I mean, just different kind of, just an understanding of like where the penalties might fall for different, to what degrees we're looking at, different infractions. I think those are things that would help me. I mean, what would be an example of, I don't know, a very small penalty versus
a failure to provide informed consent.
Obviously a sexual misconduct or something like that gets into another level. So just maybe just a spectrum of things that we might see that, could come about in these ISCs, which I'm sure they do. Like you said, they're all different, but maybe examples of how like severe, moderate, mild, or just it's a slap on the wrist, just go on your way.
So it could be one, failure to provide informed consent for some service, failure to deliver a report in a timely manner, failure to deliver a request of records, or their own records by a client, supervise an unlicensed individual for psychologists, failure to report child abuse, all these things we've seen, and all of them come to our level. That's just obviously a few, but any type of infraction, an ethical, what is a complaint process, it has to be investigated. So a client or former patient can make a complaint against a psychologist for any of those reasons, for like sexual abuse, all that stuff, or dual relationship, or all that stuff is possible.
And you can see multiple issues in the same complaint.
And
this is real life.
Further, Dr. Cartwright, I don't know it off the top of my head. There's a schedule of sanctions that we historically use. And that I don't know it off the top of my head, but it's there in the meeting. We all have a copy of it, and staff is pretty good if we have questions of, hey, what have we done on this in the past? Where have we deviated from this? And just from the institutional knowledge that exists on the staff level, of just history in that regard, to know when we're departing from maybe what we've done in the past, or no, we're right in line with what we did with the past. Also aggravating and mitigating. circumstances. We have all that in front of us in terms of what is the sanction from sexual harassment to you forgot to send a report or refused to send a report or didn't communicate efficiently. And again, just to describe the differences of how every ISC is different. I mean, we've dealt with little, paperwork things or abandonment of a client that the client wasn't passed off correctly to literal reenactments of alleged sexual harassment. And there's no training that I got that would have prepared me for that, but we had to make judgment calls based on what we saw. So.
It appears to me that listening to the more experienced members of the board, that they feel comfortable that it's not that difficult, that we'll be able to handle it as we are.
Correct.
And
you won't mess up in any great way that will destroy.
So let's not just worry about it. Go with it. And if we have any question, we have the staff who are the experts on procedures. We can just ask them the question, just like we asked Mr. Darrell question, and we'll just ask them.
Yeah.
I am open if someone would like to have a one-on-one walkthrough. I'm happy to do that.
Yeah.
I would also say something that proves that I think we're all ready for this is the level of questioning that y'all are asking about it. If you bring that same spirit of questioning to the ISC, you are immeasurably prepared.
Yes. Okay.
ISC.
Okay.
You have the prerequisite skills. You have them.
Yes. I feel comfortable listening to you all who have been serving for some time on the board. So I'm ready to go.
Very good.
Let's keep in mind the actual title of this. It's called an informal. So this isn't where you've got high-level attorneys, fighting each other on a motion. This is like pretty common sense. The majority of these complaints, I mean, they're dried and cut. I mean, somebody made a mistake and they're trying to get out of being in trouble too bad, basically.
Yeah. Good.
If you've had to ever testify in court, you've already been through worse.
Yeah.
And to that point too, you will occasionally have the attorney show up with their client, but I mean, they're just there to present the case, and then they leave with the client. They're not sticking around afterwards to litigate.
Yep.
Good.
And if they did, it wouldn't be our job to talk with them directly anyway.
Correct.
Okay, so we're gonna work on some probably some one-on-one and try to video those for future posterity to have some framework of what an ISC looks like. Is that correct?
Sure.
Perfect. Dr. Becker, your questions though, I'd love to hear your feedback after you go through it. I think that I know you'll bring that spirit to an ISC, and it is why I think you will probably be very good at it.
I just want to be clear. It's not that I have a problem with the process or that I want to make this a bigger deal than it needs to be. I just think that we need to keep in mind that our role is in protecting the public, and these are still complaints that are being brought to this board. So just because folks have been thrown frying pan into the fire previously, because that's the way that it's always been done, doesn't mean that that's the way you should continue to do it. And I just think that giving people some guidance and some expectations of what they should go into something and understand what it should be before they get there is what I'm asking for. And I don't think that that's an unreasonable thing to do. And that's really what I'm saying.
I think you're absolutely correct. That is not unreasonable at all. I do want to just, at least from my perspective of how I was trained on it, the characterization that I was just thrown into the fire, I would not characterize how the current process is that way. I think that what it sounds like from what I'm hearing from you is that that staff can probably communicate ahead of this better. But I think that at least from my perspective, I felt like I was well prepared going into it for the first time and even now.
Well, I'm on the schedule for the next ISC.
Okay.
Happy to have you.
That's what I'm saying. I'm on the schedule for the next ISC, which I believe is next month.
Good luck, Dr. Becker.
Yeah.
You'll do great. You'll do great.
And I'll be fine
Yeah.
with it. You guys know me well enough at this point. I'll roll with anything. But, you know, even so much as a tips sheet or this is what to expect going into it. Hey, let's have a phone conversation. Here's what you can expect. This is what this is. I've gotten none of that. And I'm just calling that out, that if we are going to deal with public complaint, it would be helpful to know and understand what that is. And I think that we as a board can do better moving forward.
Dr. Becker, we'll reach out to you once a complaint has been selected for your ISC panel. We'll reach out to you.
All right. Do we need to put some people on call for September 1st through November 30th to 22? Is that correct?
Yes, sir.
I would like to see if we can rotate through one of our new hang on, let's see here, make sure everybody's okay, so the current one, so we've got Dr. Becker, Mr. Adler, and me on call for the next one. For one after that, Mr. Bridges, Mr. Adler, and Dr. Becker again. June, we've got myself, Mr. Zaguris, and Dr. Singh. And so then do we need to get, probably it's up to the board. I'll take volunteers. Probably good to get Dr. Cartwright or Dr. Lambden on the next one of September, November of 2022. And I'll need another volunteer as well. Actually, 2 other volunteers.
How many hearings are there on a weekly basis within like that time frame?
Not even usually on a weekly basis. I mean,
Quarterly, think quarterly,
Yeah.
maybe 3 or 4 quarterly.
Okay.
and most of the time we allow, the format's usually 10 minutes for each side. And then we don't really put a limit on our own discussion, but usually I've seen the discussion doesn't tend to go more than.
I don't put a limit, but the free Zoom account does.
Okay. We tend to, I'm trying to think of the longest discussions I've ever had on ISC internally were probably 30 minutes, maybe 40 to get all the paperwork done. Does everybody recall any differently than that? Okay. So volunteers for September 1 through November 30th of 22.
I can
Okay with
volunteer.
me.
You can sign me up.
Okay, we'll do both of you then.
Unless you want one of us and then 2 more experienced.
If y'all are up for it, I feel good with it. If you both want to do it, we would need a public member. So I'm doing it the one before.
Well, hold on,
I thought
Mr.
we
Chair.
have to have one of the.
We need an LPA, an LPA, a psychologist, and a public member, and somebody needs to be an LSSP on that panel too.
Thank you for.
So historically, and Jody and I have just switched off. So just.
Okay, so that would be Mr. Adler. Dr. Cartwright, Dr. Landon, who wants to do it worse?
Well, you know, I would, if I could request, I mean, I thought the idea was actually a pretty good one about grouping members that were less experienced or newer members with more experienced members. And I think that just kind of makes sense, at least for me.
Yep. The reason, Daryl or Patrick, the reason that we want to avoid having people sit in to be a 4th member just observing is it conflicts them out if we actually have to take action on it. Is that correct?
Yeah, it will conflict them out. We can do that, and I mean, we've done that in the past, and I'm probably going to suggest that on Doctors Lambden and Cartwright in between now and
then
November, September of 2022. We'll have them set in on one. That'll just conflict them out if that particular complaint then goes to SOA and comes back to us.
Fair enough. Ryan, do you want to do that one?
Yeah, I can.
Actually, I'm sorry, Dr. Calhoun, do you want to do it? Actually, if you haven't.
Yes, I'd love to.
Okay, I'm sorry. I didn't realize I was looking at this here. In fact, that you're a doctor makes me forget sometimes. And then Dr. Lambden will do you then on that rotation.
Yes, and so again, remind me, the rotation would be September through November, is that correct?
22, yes.
Yes, okay.
And
Very
Dr.
good.
Cartwright will get you in the mix. And sometimes we need to sub out anyway. So if something happens with Dr. Becker, she's up twice in a row. So if for any reason a schedule conflict, maybe we can call on you.
Sure. Yeah, because September through November 30th is kind of like my literally busiest time. But if it sounds like it's not that time consuming anyway, so I don't think it would matter. But if I had a preference, I would say I'd do the one after that.
Okay.
But again, not a big deal. And I'd love to sub in on any, or even, I don't know if it's possible to just observe if it's a Zoom session, on any of these coming up. I'd be open for that too.
Sounds good. Staff, y'all heard that. So if we can get him in before, y'all know what to do. Great. Go back to my agenda.
I
Okay,
think it breaks in order, John.
Pardon?
I think it breaks in order.
Yeah, let's do that. And then we'll come back to dismissals for board ratification. How's that sound?
Okay.
All right, we will take a, let's come back at 15-minute break. We'll come back at 12. All right, it is 12:01 and Texas State Board of Examiners of Psychologists is back from the short break. We were on, still on enforcement. And I believe we've got IFCs taken care of for who's on the next round that was not assigned. We had a good discussion about that. And then I believe it's dismissals for board ratification is the next item.
Yes, sir.
All right, take it away. We don't have any.
We do not have any, no.
Here we go. Okay. Agency counsel, you ready to go?
I am, sir.
Take it away.
I don't believe we have any agreed orders that need board ratification. And I don't believe we even have any agreed orders approved by the director that need review.
Okay. Flying right through it. I'm going to take things a little out of order. We're going to postpone 6. And we're going to go, we're going to just go straight into rulemaking. So this is what most of our public comment was about today, not all of it. I'm going to open at 463.11. I don't know where to start. Lots been said about this issue. I don't know, Daryl, do you want to lay this out? Any of the nuances of this from your point of view?
Well, sure. Let me give just a quick procedural background so that Dr. Cartwright and Dr. Lambden know where we're at.
Thank you.
This is a rule that had been debated probably 3 or 4 board meetings in the past. It was proposed by the psychology board. I don't remember what board meeting it was proposed at, but it was proposed by the psychology board to the council. The council voted to propose it in the Texas Register. It was published. It was reviewed by the governor's office, published in the Texas Register. We received public comments. Those comments are what you have received that Diane had sent to you, the scanned emails. And then, of course, procedurally, what happens now is once you've published a rule and you receive public comments, that rule then has to go back to the member board. It's like what we talked about in your board member training. This is one of those rules that has to originate with the member board. So now you guys get the public comment. You have to weigh whether or not you want to recommend adoption of the rule up to the council. And so that's the stage we're at now. If the board if the board does not recommend adoption, then the rule just dies here today. If the board does recommend adoption, then it goes back up to the council at the council's next meeting to be considered for full adoption by the council. So that's where we're at.
Thank you, sir. I want to address a couple things that were said today. I think that I understand the passion around this. And when I listen to the comment and read the comment and honestly fall asleep thinking about the comments that we've received, what it sounds like is there is a strong pushback and a strong desire to protect the internship. And I agree. I agree that the internship part of this is really important. When I look at the denial that sort of precipitated and spurred this conversation, it's not that an internship didn't happen. It was based on, I believe, the number of applicants, number of supervisors. And it seems, quite narrow in how it was denied. And I question really a lot of the comments that I've heard, that the value of the psychological license would be diminished, and that we ought to respect this standard. I'm asking the question, why? What is it about this standard, and what data do we have that the number of supervisors makes an appreciable difference on the quality of care that's given? And right now, that is part of the reason why we've found a kind of a problem, I think, in our rules. So I still have a lot of questions that I have. If we're trying to protect the license, why this is important, that I don't feel have been answered, but I would turn it over to the board to have some discussion here.
Do you mind? So for my clarification, I thought I understood correctly. We're not diminishing the internship. It's not like a waiver for, you don't have to do an internship to receive a full license.
That's correct.
That is not even close to what was said in the rules. So I don't think the board is of the opinion that we are lessening the standards. What we are providing is an avenue. I don't think anybody, I strongly believe that anybody who comes questioning licensure through this board who has not completed internship by their own choice would ever be considered to apply for a license based on that. We are talking about hardships here,
Yeah. I'd ask the attorneys to chime in here, but the point is that the section 1, which is right after it, applicant completed at least 1,500 hours in formal, 1,500 hours supervised following conferral of a doctoral degree, is you have to at least meet that requirement to even consider anything, any discretion that we would use. You have to have at least 3,000 hours of supervised experience minimum before we would even have this conversation. If I misstated that, Mr. Spinks.
No, that's correct. Yeah, if you haven't had any internship, you're not even eligible to request or petition for a waiver or modification.
Right, and furthermore, when you look at the last part of what we're doing here, the council may approve or deny a petition under this subsection, and in the case of any approval, may condition the approval on reasonable terms and conditions designed to ensure the applicant's education, training, and experience provide reasonable assurance that the applicant has the knowledge and skills necessary for entry-level practice as a licensed psychologist. And so when we're looking at applicants, and there's a deficiency, and there's some way that we would, in the wisdom of this board and all of the practitioners on this board, to say, hey, I think you're missing X, Y, or Z, go solve X, Y, or Z. My understanding is that we don't actually have a framework for that in the rules to ask them to go do X, Y, or Z to cure a deficiency other than going back to school.
Correct. They would either have to go back and get a new doctoral degree or undergo respecialization training, which is a pretty expensive endeavor in and of itself.
So I'll try and answer the question that you've asked and reflect back where the public comment is sort of coming from in a huge upswelling of a way. I think the reason that folks are so fixated on the internship and why you're hearing this sort of overwhelming swell is that it opens a door, whether intentionally or unintentionally. It erodes the sanctity of the internship by saying that there is the potential that all of the standards that we have set up the licensure to meet in our state may not be met if you offer a waiver that could potentially allow for someone to practice in the state of Texas that has not met every single checkbox under that internship. And by doing that, you set up a couple of different things. One, you set up the opportunity for the public to not know and understand whether or not you have a practicing psychologist who is meeting all of the requirements that we say is what it means to be a practicing psychologist in the state of Texas. That's where the erosion piece comes from. Because if we say over here, it's because this particular individual that sparked this debate is because it's that they didn't have 2 supervisors at their practice site. But the next person that comes through could have a very different issue that could fall under those canon that might be very fundamental to the practice of psychology. And we have now opened the door and set a precedent that could be extremely concerning. The second piece that I heard, and I have, believe me when I tell you, my phone and my email has been backlogged like you would not believe for the last 2 months, is that piece of opening the door erodes our credibility, that standard then makes it so that we may no longer be able to be a part of SIPAC, that might question whether or not our licensure meets the minimum standards for SIPAC, and that could endanger that relationship. That the way that APIC recognizes internships and fellowships and training programs in our state could be questioned by that waiver rule, and that licensure in our state could be recognized differently. That psychologists who want to get board certified in our state suddenly would have their licensure in the state of Texas questioned and scrutinized differently if they are wavered into their licensure in the state of Texas differently. And then that fourth piece of, as a public individual, how do I know if my psychologist is wavered into licensure or they are granted licensure under these rules? And do they mean the same thing? And then that fifth question, which we really haven't gotten into, is how do we as a board set a standard for what is a waiverable thing and what is a non-waiverable thing? And do we really agree on our judgment and our ability to say this meets a standard and this doesn't, when frankly, we can't even agree on that when it comes to what, my opinion, is very clear and basic based on our last board meeting. So I think that is where folks are getting into that erosion piece. And that is what you're hearing. And that is why the focus is on the internship. And I do hear what you're saying. And, you know, I really fell on the side of remediation and wanting to offer folks who we feel like really went through all of these hoops and to have the opportunity. But I really question whether that is efficient, effective, and within the boundaries of what we should be doing on this board.
Can I ask our attorneys real quick to the SIPAC question in other states and what other states have done? What does this do to us in that regard?
Yeah, can I answer that, Chair? My opinion is, regardless of whether we change this rule or not, this rule change goes through or dies, it honestly should have no effect on SIPAC. Now, whether or not what SIPAC does, we don't have control over that. But the reason why we're in SIPAC is because subchapter L of chapter 501 was passed by the legislature. That compact language being adopted by the legislature and mirroring that compact language that's the standard compact language for all other states is what got us membership into SIPAC. So regardless of whatever our standard is that we set under a board rule, should have no implication for SIPAC. And I'll give you a very specific point. In order to join SIPAC, in order for a Texas psychologist to get credentialed through SIPAC, they have to get an e-passport through Asppb. The standard for the e-passport is you have to have graduated from an APA accredited program. In Texas, you don't have to graduate from an APA accredited program. You can do an APA or a substantially equivalent. And so the standards are not the same. So not all Texas licensed psychologists can qualify for SIPAC currently. Whereas if you're a Georgia licensed psychologist, their statute requires APA accredited programs, whereas ours does not. So we legally can't just adopt APA and say, we're only going to take APA, because our statutory language is different. And so the standards for what's in Georgia and what's in here are different. So to bring it home, no, this rule change will, even if we're allowing different people in to become licensed here, we're already allowing different people in than what SIPAC already requires. Their credentialing standard is different. So it honestly should have no effect on SIPAC.
You're saying there's lower standards elsewhere already that people could go through another state to get here?
I'm sorry, can you repeat that?
You're saying that there's lower standards in other states that you could go through another state and get here?
So if you, just because you're licensed in Texas does not mean, we don't have any reciprocity agreements with any other states right now. So just because you're licensed in Texas does not mean that you can automatically get licensed in another state. You'd have to go through that other state's licensing process. And if you're licensed in Texas, you can't, and you didn't go to an APA accredited program, you can't get licensed in Georgia, because Georgia will require you to have an APA accredited program. Now, other states have different requirements, whether it's that not everybody has the same number of supervised hours. We would have maybe a different number than some other states would. So honestly, it's, you throw a dart on a board for each state, they're all slightly different. They're not all necessarily the same. And so just because you're able to get licensed in one, you might be able to get licensed in another, but you may not. I wouldn't be able to tell you what each state's requirements are, but I do know it's a discussion we had at SIPAC where, I was hopeful to try to get every Texas licensed psychologist into SIPAC, and it's set to what the e-passport is set to, requirements are set to, and that's set by Asppb, and that's in the statutory language in subchapter L in 501. So we have to set it to that e-passport language, which we don't have any control over. So I don't know. I hope that answers your question.
Yeah, it does.
I would also add, Mr. Chair, that we are not I know some of the comments seem to suggest that we would be the first to do this, and that's incorrect. Both Minnesota and Illinois have waiver or variance rules, just like what we're proposing. They're worded a little differently. If y'all will recall, I had told you early on that kind of the concept for this particular wording came from Minnesota. And I included the Minnesota rule in your board meeting materials. It's under the 7B SIPAC member. You can look in there. Both Minnesota and Illinois allow waivers and variances of the internship. And one other thing I'd also add is that when you start looking at that internship stuff, you'll see that it's not as standardized as what people think it is across the country. You look at Illinois, for example, doesn't seem to be nearly as detailed of a rule as what ours is. I don't remember seeing anything in there about two supervising psychologists, 2 interns. We got to be careful saying that it's so standardized across the country, because it's really not. The concept of an internship is, but kind of the guts of that internship, I think you're going to see some variation.
I think it's worth noting in the rule. I after reading the 400 some odd pages of comments that we had, I'm curious how many of them actually read this rule. A lot of the comments looked like they were copied and pasted from exactly the same thing, and I take even seeing that seriously, because I know that it mattered enough for them to send the letter in the first place. But this enshrines, in terms of us being able to have discretion on waiving certain things, it enshrines 1,500 hours on either side of the doctoral degree. And if you don't meet that, sorry, we're handcuffed, and we are handcuffing ourselves and future boards, that there are certain lines that we will not go outside of. And I just heard a lot of comments saying that we're attacking the internship. When I read the rule, it frankly enshrines it even more so.
Yeah, the rule has in it where the board can exercise its judgment on a case-by-case basis. A lot of the comments I heard, they were going to do away with the rule. Don't do away with the rule. Patrick mentioned change the rule. I don't think we're changing the rule, and I don't think we're doing away with the rule. We're looking at one particular case, and regarding this open door thing, you can open up the door all you want, but every case is going to be taken as a case-by-case basis with its own merits and its own negatives. So I don't really think that this whole thing is to change the rule. Now, correct me if I'm wrong. On an opinion point of view, I've worked for 45 years, and nobody's going to tell me that all my learning was because of some internship or some practicum. I do value the practicum, and I do value the internship. And I think the reason we value those, again, this is my opinion. I'm not a PhD. I haven't ever been in a pre-doctoral internship. But the reason why we have the practicums and the internships is to see a person that perhaps isn't meeting even the basic requirements of empathy and understanding and being able to interpret tests, etc. The place where we learn how to be psychologists and help people is after we graduate and get in there and start doing the job. And this is no different than an auto mechanic. It's no different than a surgeon. I mean, yes, the surgeon does learn basic technique, but it doesn't prepare him for an artery busting. You can't train that in a practicum or an internship in a hospital. There's going to be things that you learn that are post-graduation, not post-internship or post-practicum. So I believe that putting too much value in a practicum probably is at the basis of this argument.
So Mr. Adler and then Dr. Lamb.
Yeah. So think of this akin to like the legal system. If they make new laws, we are involved in public policy in the field of psychology. In other fields, like the Supreme Court, they make laws that they may be equally kind of like dangerous, and they bear that burden. We bear this burden. We accept it because we make the public policy and we create it, even with the risk it takes. It opens the door, but that's what we do. That's what we do as in this board. We're not looking to only create rules that have, such narrow, possibilities that it won't ever come to us and create trouble for us. But that's what our purpose is in my mind, to bear this burden, to accept it, because, there are certain situations where people are not given the proper possibility, and it's not about people, we're just saying screw the internship or all that stuff. It's much more fine-tuned than that. And I trust us. I trust my peers, we all make the right decision. So I feel like this is what we do. We bear the burden that it causes because we accept it. That's what it is to create rules that affect the public.
Dr. Landon?
Yes, so I was just kind of thinking about this, and I take to heart what everybody has said. And I think there's some issues that are pretty relevant here. It really makes, and I want to call your attention actually before I begin to the publication that we received as board, all of us as board members in the Texas Register. On the second page of the proposed rule of board 463.11, the second page, about the middle of the page, it delineates, and I want to call your attention specifically to, I believe it's Article 5, 6, and 7, and I'm just going to quote here, so bear with me. It says, the individual face-to-face supervision shall consist of no less than 25% of the time spent in service-related activities. 6, at least 25% of the practicum hours must be devoted to face-to-face patient or client contact. 7, no more than 25% of the time spent in supervision may be provided by a licensed, allied mental health professional or a psychology intern or postdoctoral fellow. So yes, I wholeheartedly concur with some of the comments that I've heard in terms of there, I think, are some misconceptions or misunderstanding about what the actual proposed rule states, the content of it. And so I want to talk about the changes to the quality of the program is really what we're getting at. We are not eliminating, we're not replacing it completely, but we are affecting the quality of the preparation, the formal preparation that we expect from our applicants. And so, you know, when you do that, it really makes, like I'm thinking, how does a supervisor really know whether or not they can clearly recommend an intern for further formation of formal training if they've only been with them on site 25% of the time at that internship? I would imagine that that substantially reduces the, I think the current requirement is 50%, if I'm not mistaken. Feel free to correct me if I'm wrong.
Dr. Lambden, your audio is
I would
breaking up.
imagine it reduces some of that ability for that super. Sorry, can you hear me? Is that better?
I can't,
Is that
Dr.
better?
Lambden, can I, let me, I don't want, I hate to interrupt you, but I'm
Sure.
gonna make a suggestion. Do you have a speakerphone or something nearby where you could call in, leave your video on and call in?
Or maybe even turn off the, can we?
Yeah.
No,
how's that?
no,
Is that
we can't.
better?
Sorry.
Yeah, we can't
that
turn off the video. Yeah, I'm hearing you okay now.
Okay. So what part did you miss?
Back up like 2 sentences. Right
Okay.
when we interrupted you, you were going out, but we heard most
Okay.
of it.
So what I was basically saying is currently the rule is, the expectation is that the supervisor has to be on site with the intern. I believe it's 50% of the time that they're there seeing patients and clients. This would diminish that requirement to 25%. And so I'm thinking if I'm a supervisor, I would have difficulty rendering a decision or a recommendation based on my personal first-hand information about whether or not this intern has the skill set, not necessarily the content, but the skill set in conducting therapy to recommend for them to move forward in their formal training. I think that would be one concern that I would have if you reduce the quality of the internship to have that supervisor on site. The other, I think, issue that is at stake is basically you're expecting that intern to 75% of the time practice on their own without the benefit of a supervisor to consult. If you look at it that way, in some ways it really, I mean, and the other thing I think that I saw on the application and some of the issues that were at stake is rather than requiring 2 interns to be present in that formal program, it reduces it to, I think it eliminates that requirement and it only allows 1 person. And sometimes, excuse me, because people come from rural communities or other communities where it's very difficult to attract other interns to the program or to that training site, that would be something that would be modified in this proposed rule. That's my understanding. Feel free to correct me if I'm wrong. But I think in essence, it turns an internship into a mentorship where you just have that one-on-one interaction with this supervisor at 25% of the time that you're on site. So I do think that it, you know, we have to really carefully think about that, about the quality of the individuals, not in terms of content, but in terms of the process, how they operate, where there's such a, if you will, a nuance and so many different issues that could come up that need attention in a crisis situation or what have you, that maybe an intern is really ill-equipped to handle at that point in their training. And I think for us, we have to really think about where, you know, this rule or these changes make the training vulnerable, possibly to abuse in some way, you know, to modify the training at some level. So I think that's something to consider. And I get it, I understand, I think Texas citizens deserve access to mental health and quality mental health. And as I think about that, we have challenges as Texans. How do we make access improved for all citizens? But really, we're talking about individuals that come from rural communities. I don't think that has to be reinvented. I think other professions have done things like that, such as the legal profession, the medical profession. Other professions have done that in terms of maybe, I know this is outside the purview of this board, but there are programs out there for incentivizing perhaps more supervisors to be on site. And what we really need to do is we need to look at do that. One is to reduce the standards. And I'm certainly not, I don't think for that at this point. I think there's other better ways to increase access for citizens of Texas for mental health services. I think the other way you can increase access is that you increase access to resources and not necessarily financial. We need to figure out, I think increasing our provider goals that in this we're well above the target for licenses, increasing those numbers. But if we can figure out how to take resources from counties that are resource rich and allocate some of that perhaps in some sort of a program where where individuals are resource poor, then I think maybe we can start to make gains in that direction.
Dr. Landon, were you just talking about telehealth? Is that what I heard?
Yes.
It's interesting. You highlight actually a problem, and you didn't mean to, in terms of things that I live in Waxahachie, and my internet connection in my own life, we've tried telecounseling, and it's really hard. And even with your internet connection, I think you're in Kerrville, is that right? Did we lose her?
Yes. No, I'm here.
Okay, see,
I can hear you.
This highlights the problem. I can't hear you, and that's the challenge between even telehealth. It's easy. I've heard comments today from Travis County, which has I'm looking at it here, over 1.2 million, almost 1.3 million psychologists. Just psychologists. That's not practitioners. We're talking psychologists. We're looking.
No, not 1.3 million in Travis County.
Sorry, that's the sorry 600. Thank you for correcting. I'm looking at the wrong thing.
We're getting shortchanged on our renewal fees, if that's what it is.
667 here. Thank you, Daryl. And it's just under 1 per 2,000. Talking about, we're going to talk about in a minute, Angelina County, which I believe has 5 psychologists. And so the point is that telehealth doesn't always work, and that's part of the problem that we're not going to solve here and today.
I think you have to think about the scope of the rule and the scope of this board, though, right? So the scope of this rule says that we would be waiving aspects of the psychologist minimum standards of practice in an effort to allow people to practice with the same equivalent licensure, which in representation to the public makes them equivalent. Let's understand that for a second, okay? And that you are putting that judgment in the hands of this group, which I'm not sure that I'm wholly comfortable with that power or that understanding. But even if you did that, let's talk about what that should be and what that should look like. That should be, by definition, an exception rather than a rule. That should not be a pathway to licensure. That should be a rarely used exception by virtue of what everyone has talked about here, right? So this discussion and this support that we have gotten for this rule about this being an access to care model is not true, and it should not be true. This should be about giving people access when it is not possible or remediating something. And I heard something in one of the public comments, and I wrote it down because it really struck a chord with me. I'm gonna find it. Someone said something about, and now of course I can't find it. Dr. Flynn made the comment about, this is the potential to serve someone who did not dot all their I's and cross all of their T's and give them an avenue for licensure. That makes me woefully uncomfortable. Because if you are seeking licensure at a doctoral level and you have not dotted your I's and crossed your T's, that goes back to whatever conversation happened on Friday, where Daryl said that if someone can't find the address for the board on the website, then perhaps we have a problem. Because that is a workaround that I personally am not comfortable with. And I think the outswelling from the public and our constituents that we serve has to be heard on that. And that is what I'm hearing very clearly. So I'm a little bit uncomfortable with thinking about this as an access to underserved populations. I mean, talking about telehealth and access to care, I am there for it all day. I live in an emergency room, guys. But this to me is not the pathway for doing that. So I think we need to acknowledge that. And I'd like to hear from some of the other folks who haven't spoken on this yet.
Well, I think the mere fact that this issue has drawn attention from the American Psychological Association, from the Texas Psychological Association, and from Associates for Applied Psychology. We've never had that kind of attention brought to any issue since I've been with the board. And I think Brian Stagner really sums it up, because he states in his letter that he thinks that this will diminish the value of mentorship, which is central to the mission of an internship, because some people are going to get proper training and others will not. And he goes on to say that the board will waive its right on a case-by-case basis, and we will have no credibility at all if we make decisions like that. And I agree with him completely. I think that if a person has not completed the requirements, they need to go back and complete those requirements. And I live in East Texas, and I know that we are putting in additional teleconferencing equipment and supplies, and that we just received a substantial grant to do that. I think we got $59 million, and we're expecting another 50. So there will be more access to internships or to the internet. But I don't think that people, and I just speak for myself, I mean, if I should need the services of a psychologist, I would like to think that that person dotted all the I's and crossed all the T's and did all of the things that were required. And I would not be, how would I know as a citizen who did that? You know, you just expect people to have met all of the requirements. And somebody said something about a surgeon, you know, they learn as they move through the process. No, they do a fellowship. They do a fellowship. They do a surgical fellowship. And that's where they really learn. So I think that the internship and the mentorship, that's just as important as the fellowship.
I guess here's my question again. We're not getting rid of the internship. And I want to be clear again with what precipitated this. It was a denial letter, which the primary reason was the fact that there were not there were not 2 or more full-time licensed psychologists on staff as supervisors.
Yeah.
And my question is I forget which part of the rule it is, and even TPA in their frequently asked questions, which I've read about this, in terms of access to care, which I think access to care is a part of this conversation, and apparently so does TPA, because it's on their FAQs on the rules. We acknowledge it is becoming difficult for students in some regions of Texas to obtain a valid internship training experience. I agree with them, and that's part of the problem with this rule, with these two. I still don't understand why it has to be 2, especially in areas that are underserved. You get into this chicken or the egg thing, which nothing's ever going to move if it requires 2. When in many counties there are none. In other counties, I looked at Orange County, county of the Speaker of the Texas House, it's 1 per 86,000 people, 1 psychologist, and we don't even know if they're practicing or not. In many cases, a lot of these psychologists in these counties that are on the books aren't even practicing. So how do we have, who's going to be the first intern out there? How do we fix this if we have to have 2 in some cases? Again, that was one of the primary reasons that precipitated this rule.
So John, if I may.
I think that with the internship, if the person is having difficulty where they are and getting an internship, then they go where they can get the internship until we can have maybe internet and that sort of thing that they can access. But I mean, if you want for example, a PhD in psychometrics or something like that, you might go to Florida State, or you might go to Atlanta University, because you know that you can find it there. When you're in psychology, I think you ought to be prepared for the fact that you might have to go somewhere else to complete your internship. And that's what you do if you really want to complete the requirements, if you want the credential.
But why is 2 important?
I have something to say. I appreciate everybody's thinking on this, but I have supervised interns graduate interns for 30 years. I did. I'm not doing right now. For 30 years I did. And I know a lot about internship, and I know how students can try to take advantage of some loopholes and get into places with their friend, because friend will supervise, and it's more convenient site and so forth. And that's where the supervisors are very important. They supervise that the intern is getting the kind of internship that's necessary for this license, and the supervision they're getting is the kind of supervision that's necessary. And to say that internship is not that important is absolutely incorrect. I have seen students who were A students throughout their program, and then as they went through their internship, decided they no longer wanted to be psychologists, or they no longer wanted to be in this mental counseling area, or they want to switch the specialty because they found they did not have the kind of personality or the kind of other things needed to be a good counselor or good psychologist. So there's so much in training goes on during the internship that is crucial for the development of the future counselor or future clinical psychologist. So internship is absolutely necessary, and I do not see that any exigency, any such need that this person has to be given exception because she's doing the same thing. She'll be doing the same thing she's been doing all along with under LPC certification. And also that point that Dr. Baker quoted another psychologist saying, not dotting your I's and T's. If you can do that and you are going for a psychologist license and training, what kind of counselor are you going to be? What kind of psychologist are you going to be? You're going to be guiding in future people to make the very best decisions. If you can't make the very best decisions for yourself, your own path to career, how do you say that you will be that kind of a counselor the best kind of counselor for others? So there are many, many questions as an academician that I question about this situation. And Dr. Culhon made a statement that is very important, that when people are going for PhD program, they're trying to become psychologists. They don't say, well, I live in Ballinger, Texas, so everything that I needs to be given to me around Ballinger, Texas, where I can drive, where I can continue living here and get everything. They look at their interests, and then they say, where are my interests going to be met? They seek the university, and then from there, when their interests might change during their training, they seek the internship that would fulfill their interests. And so I just cannot accept any of those arguments to bend the rule for this person. And I also cannot accept the argument that we should be making person-to-person exceptions when the rules are very specific and stated, unless there is an exigency. And I don't see an exigency there. So I would, the public comments were made by very credible professionals, very professionals that have lived their life throughout, their life. They have served the profession and the state of Texas, and the associations that are behind these professions, and I cannot overlook all those. Thank you.
Let me just say one thing, like the public member who mentioned that term, cross all the I's. I don't think we're here to defend what public member's comment was in support of this rule. He may have said that, but that's not what the point of the rule was. So I wouldn't quote him as saying that that's what our intent was, because the public member, a public comment, try to describe it that way. Just want to make that clear.
I also agree with the concerns about changing the standards of training, but I also have some issues just with the problems with the criteria for a waiver. What makes someone eligible? How would the board, I just see a landslide of issues and obstacles and problems, to be honest, in general. But to be more specific, how would the board be able to differentiate deficiencies on a case-by-case basis without this setting a standard for those with attorneys who have representation versus those who don't? That's one. Simply saying my reason is better than your reason. How do we identify or evaluate what is passable and what is not? I mean, there'd have to be very strict criteria, and I don't see that in this proposal at all. I see no actual criteria. So without proper delineation for special qualifying criteria, how can we set this into law at this time without being in constant litigation? Also, someone made reference to the point of abusing the system. We could have people that move to particular areas to sort of, find loopholes into getting this licensure or getting this training, and essentially becoming licensed. So they could, again, abusing the system. I have some ideas, maybe down the road of how that could be eliminated, but I also see this where it could cause an unbearable landslide of similar cases, going retro 10, 15, 20 years back. Where do we draw the line here? For everything since and in between. I also just feel like it could cause a lot of problems with the board going forward. It could cause continual litigation, increasing denial and appeal issues that would be overburdening the board. And also, not to mention that this would not, I feel like this would also apply directly to LPAs in the same situation that they're having, where kind of riding the system, or again, just basically all the points I made for the LPs would be exactly the same for the LPAs. In that level. And those are just some thoughts I had. I will say that, the access to care issue is huge. I've worked in Fannin County. I've worked in small towns all over West Texas, Central Texas, Permian Basin, South Texas, there are areas where it's very tough to find a psychologist. So, I mean, this is an issue that we need to work on. And especially when you add in the factors of Medicare and Medicaid oftentimes won't credential. You can't get other providers like LPCs and LCSWs oftentimes have trouble being credentialed with Medicare or Medicaid or not allowed at all. So I do think the supervision by psychologists needs to be rethought and how we can rework that to kind of overarch that umbrella so that those providers can bill under psychologists. Obviously, COVID-19 caused a lot of problems. You know, we talked a little bit about telemedicine, and I know that's where it's going. We know that in a lot of ways that's where it's going. But I work in skilled nursing facilities all over, and I do know the need of having face-to-face contact in these, especially in these remote areas. It's tough. We've got a lot of problems to solve, but I think we can do that as a board. The other area that I wanted to address that I believe Elisa Sherry mentioned in the written comment, but again, just the amount of APIC programs versus applicants, and I think she mentioned that 44% are not able to find placement. So that's a problem. We need to increase the amount of APA accredited or equivalent internship sites, and that's something that I think needs to be addressed and worked on as well. So there are problems. I just don't, think based on this one case, we need to change all these standards and the criteria issues. Among other things, protecting the consumer and the APA national standards, along with the Psych Pact issues. With Psych Pact, we do need to hold. And again, going back to Mr. Hyde's comments, though, that made me kind of rethink that. But with Psych Pact, we're able to bring professionals that are licensed in states like Georgia, all over, now Ohio, other states, where that we can bring in qualified professionals to come in and provide services and in our remote areas and our tough areas as well. So, we don't want to jeopardize that relationship because we have the ability to bring in and help the consumer more in harder hit areas or more difficult areas. So those are just some of my points I wanted to make.
Thank you.
One of the things I have not heard from any of the board members is a discussion on, everybody seems to be focused on the waiver component of the rule. And I haven't heard any of you talk about why you think the modification component, I mean, how does that factor into your decision? Because the rule allows you to either waive or modify a requirement and impose some kind of additional hoop that they could jump through to make sure they meet, that they're safe to practice. So, I mean, I haven't heard anybody talk about that. So where's that factored into y'all's thinking?
I had heard Dr. Callahan talk about that in one of the meetings where she had suggested some remediation, and some places near her that have internship sites that are suitable. Do you remember that, Dr. Callahan? You had talked about it.
Yes, I do. And yes, we're doing more things to provide access to care in East Texas, and we have psychology programs at UTT. For those of you that don't know about the merger, UT Health Science Center has a master's program. They have a PhD program. They're actually with the interns, they're going around to agencies with mentors. I actually have a postdoc that I wrote a proposal for. And so, we have postdocs that are staying for 1 additional year, postdocs that are staying for 2 additional years. So it's not as bad as it was. And, and we've had a lot of help from Senator Nichols in making these things happen. And so these things are all getting better. And, I don't know anybody in rural East Texas that wants a psychologist that did not dot all the I's and cross all the T's. I certainly would not.
For the record, Dr. Calhoun, Senator Nichols is in favor of supporting this rule and specifically asked us to pass it.
Yes. I'm well aware of that. And I read his letter. And what I said just now was that Senator Nichols has done quite a bit to help us to get additional services, psychological services and counseling, and to grow programs in East Texas, okay? So that was my comment. Wasn't disputing anything that Senator Nichols said. I was just telling you what he has done, and that's appreciated.
I do wonder if there is some room for some thought on the middle ground here, which is to say, I think that we as a board need to hear what the concerns are about this particular language and the concerns about the erosion of the licensure as it's set forth here. And particularly how we are talking about waiving aspects of the qualifications of the licensure as it's set out. And I do wonder if there are ways to head in the direction that Dr. Cartwright is talking about, with being more specific about what it is that we are talking about doing in a way to modify re-specialization for folks who perhaps are under-resourced in specific ways. Basically, forcing us to be more specific about what we're talking about and not opening the barn door to make us vulnerable to watering down our licensure.
You know, I think, can you all hear me?
Spotty.
You're breaking up.
Can you all hear me?
Yes.
A little bit? Sorry, okay.
For now.
Okay, so I'm going to try. Okay, so I think one of the issues here is when you talk about modifying, you're not really talking about increasing the standard. You're really talking about reducing the standard. Because if individuals come up toward the board and are asking for waivers or modification or special circumstances, they're asking us to think about how to remediate some of their deficiencies. And if they're already in a position where they're having trouble finding a supervisor on site face-to-face, you know, that avenue is not going to be open to them. And so I'm not sure how much really value there would be when you get right down to it in terms of the modification. Content, I think, is possible, of course, but not in the process of actually doing the human to human aspect of it.
It's a really good point.
I'll tell you what I'm still wrestling with is that we're not talking about getting rid of internship. And I've heard that we need to have, you know, an ability to require additional steps for somebody to get licensed. Right now, we don't have that capability under the rule. This rule allows that. I also want to point out, I've been here 6 years, and from my understanding and questioning and asking and talking to board members who were here before me, and through my tenure on the board thus far, this board has always exercised a great deal of restraint. It has not been an activist board. And we say no often. I know it's SOA that plays into it sometimes. Daryl, what we were talking about this a while ago about SOA and us, and sometimes refresh my memory on it. Do we do more restraints than SOA? We've historically done more. We've restrained people more than SOA, and then SOA comes back to us and says, no, you can't do that. You went too far. Is that?
Yeah, I started to say, yeah, correct. You had one not too awful long ago. An individual came over, didn't meet qualifications. We had no way there was no wiggle room. We denied her. SOA came back and said, well, it's close enough. And they ordered us, you got to take her in. And so, I mean, that was the PFD. We didn't have a choice to go with it at that point. So we got overridden.
Is that this board traditionally it's hadn't been a floodgate opening. It's been quite the opposite. The board has traditionally held the line. But again, what precipitated this was a specific one. The main reason for denial being the number of supervisors and number of interns. And I question, why is it two? Why is two, does that have to be is that the metric that we're going to hang our hats on? That's the difference between somebody being able to do a good job as a psychologist and not. And I can't imagine that one or two makes that difference.
Well, we're
John,
talking
if
about
I
the
can-
difference between
if I-
APA accreditation and not. It is a standard that is adopted because it is the most common standard across the United States. That accreditation standard is one that is just the most commonly adopted in training.
The problem is that just because it's the most common doesn't mean in today's legal environment that it actually will hold muster. There have been Supreme Court cases that have talked about this, that just because it's always been that way doesn't mean that it can continue to be that way. If we're going to have a restraint of trade, a restraint of somebody, and licensure being a restraint of trade, you've got to pass muster. Whatever those hurdles are, we have to have data or some reason to hang our hat on that this is important for the public and this is exactly why. And again, the main reason for denial of this application was the number of supervisees and supervisors. And
I have another information piece of information.
hang on just a second. With that being the main reason, what is the data-driven point if we're going to limit somebody from getting into the industry to be a psychologist? If that's the reason, do we have data to hang our hat on?
Okay, we have you asked the question why two and why not just one? Well, usually when some facility declares that they will take interns, they have supervisors for interns. That means they have well-running facility. They have multiple practitioners, but one can be just somebody in private practice and your friend, and you can go start doing your internship in his office with your friend. And that, of course, is already when you do already some ethical compromise right there. And you can do that, but that's not acceptable. So the reason it is two or more supervisors, because that's how much it takes to have a good facility where a good number of clients are being seen by multiple practitioners, and they cover each other. They have some kind of program. They have some kind of specialties and some kind of acceptability as an internship site. So that's why you can't have one. And
John,
I know,
sorry. I want to let you finish.
I know that some of my interns, they wanted to work with somebody they knew very well, or they liked somebody, and they had a office, and they were seeing clients, and they would get them in there, and they'll be basically answering phones and doing really very little psychological work, services work. And I put an end to all that when I was supervisor. And so it's not fully it's not credible site when you have your friend supervising you or one person supervising you in a facility where they're just seeing some clients, and then you just do some work for them. Okay, go ahead, Doctor.
Dr. Landon.
Thank you so much. There's also another practical reason, and that is that when you think about it, a lot of the training sites are community mental health centers. Oftentimes, there's some sort of a community center, whether that be at a university or they're a community mental health setting. And for most people need to come, since it's a regular appointment, they need to come after hours, after their jobs, or on Saturdays. And so to expect one person to cover Monday, 8 a.m. all the way through Saturday evening or afternoon and then out, and then say maybe sometimes even into 9 o'clock at night, Monday through Friday. That's just not possible when you hire and expect one person in that position.
It's also about safety of trainees, just to be clear. And the reason that APA does it, and the reason that internship sites are required to have more than one supervisor, is actually about grievance and due process. And that is because when you have one person, and if there is an issue in the supervisor and supervisee relationship, they have no one to complain to. They have no one to bring that issue to. And when you are talking about the learning of psychology and mental health, that is a requirement in training that you have a second person to bring those complaints and those issues to. It is part of the process of learning and supervision. And that, John, is why it is so important in an internship to have two supervisors. It is genuinely about the grievance and the due process issue of it. And that is why it is the standard of supervision to have two.
I will say our rules already prohibit a supervisor from providing supervision to a friend or a colleague. If you look at 465.13, that's a rule y'all are going to work on today as well. So I have trouble buying the argument that, well, one of the reasons we do it is because they might pair up with a friend or a buddy. You can't do that anyway under the law. So
It's supervision and it's due process and grievance.
Mr. Spinks, it's difficult not to have friends and acquaintances or friendships in a little town. You don't.
I agree.
Yeah.
I agree.
I don't live in very little town. I live in 100,000 people's town, and I know practically everybody. And I can, if I needed mental health services, I wouldn't go to anyone here. I'll have to come to Austin or San Antonio.
Dr. Singh, you highlight the hugest problem though. Like that's why we need practitioners in rural areas, more so because not everybody can go.
Yeah, I understand that. And I fully appreciate that. And there is no exigency for this doctor to have psychologist lessons to practice in that rural area. She's already practicing very well in that. And second thing, that's not the case. When you live in rural area, there is no PhD program in the rural area. You go to Austin or to Dallas or to some other place to go to school. And you know that you have to go to different places to get your education completed. So this is not the issue. Issue of rural area only has to do is that we want to serve the rural area as well. And that is not by bypassing the rules to just let any Tom, Dick, and Harry come in there and practice. You have to have some standards that you must stand by no matter what. And otherwise, we can keep giving exceptions, waiving this and that and the other, that all those letters that were sent to us by professionals and the associations, they highlight those issues very well. Then I can word them and I don't need to repeat them. But I am very convinced that we need to not do this. We need to actually keep the standards very consistent, and very rarely the exception should be made. And they have to be with something, not when there is no exigency, something very, very important. Can't think of that right now because I think the rules are very well written. Rules are clear. I follow the rules. Everybody else follow. Whoever else is on this board has followed the rules. That's why they are where they are. And we charted out our path, and I don't see that in this case.
Just to be clear, without this type of rule, even in an exigency situation, you cannot waive or modify anything. So you have you have zero discretion. None.
And that to me highlights the difference between, we have two issues here. One is somebody who has an application before us, which we're going to take up in a minute. The second is a rule. And again, I've heard that described, that we need some discretion at some point. You won't have it if we vote this thing down. And it's as simple as that. It's just going to be interpret the rule. Ryan?
So that's the point I was going to make, actually, is what Mr. Spinks just said, is I think we're getting way too lost in the weeds on this and trying to figure out all the specific individual situations where this would play out. The fact of the matter is, this isn't changing the rule, in my opinion. The rule still requires all these different requirements. I think this is a very narrow and infinitesimally narrow set of circumstances that this would be actually utilized, but it gives us the option to utilize it if we needed to at some point in the future. Currently, we don't have that option. And, I think we as a board should have a little bit of flexibility there if we need it. I don't think that dilutes the rule any. I don't think it dilutes the licensing any. I think it just enables us to have the conversation, like in this case that we're going to be talking about in a little bit here. If this gets rejected, then it's a flat rejection regardless of the situation. If we approve it, we can at least have the conversation around it. We might still reject it. I think Mr. Blamlett said this a little while ago. This board, I've been on here 3 years now, I guess, and we have given a very short leash with stuff like this in the past. So I don't think this is just going to turn into people trying to game the system to get licensing that they wouldn't otherwise get. I think this enables us to look at those situations, and if we do see someone trying to game the system, then we can put a stop to it.
Well, anytime you set a precedent, that is a rule. Then you meant the rule, because precedence is what create the future rules. So precedent is, if you set this precedent, we will have a similar situations where we will have to have.
I disagree though. I don't think we have to do anything. I think in something like this, our rules are our rules. This gives us the ability to look at stuff. I don't think that has to be precedent setting.
Yeah, and you can always break precedent. I mean, we've done it on all sorts of things, and when some new situation arises that warrants it. But you don't sanction someone on precedent. You sanction somebody on a rule.
Who's talking? Who's talking?
This is John.
John, where are you?
I don't.
I'm not able to see who is talking. Okay, go ahead.
This is John. Yeah, and the point is that rules are rules, and if we went to Patrick or John Bridges or Daryl to sanction somebody, we're not sanctioning them based on precedent. It's based on rule. So just to echo Mr. Bridges there.
And to be frank on that,
we wouldn't need to exist if we didn't act on these things. I mean, you're right. The rules are the rules, and if we just follow the rules and pretend that there's not human beings involved here, then we don't even need to be acting as a board. Then we got the rules. Let a computer decide on it.
And I think there are ways to maybe work with the rules, though, such as like if you had an APA, someone who's been through an APA accredited program offering supervision remotely, in situations like that, it's just that it's not in this rule at all. So it's kind of like a non-starter in essence, that it's just not there, and we don't know what way that will go. And so I think that's part of the problem. I think it's almost like it needs to be rewritten to actually have caveats that maybe allow special circumstances that in certain cases, and then it can be interpreted based on that, where precautions are already taken, such as must have residents in area for 3+ years before, in rural area, things like that, that I'm just making points, but it's just nothing's in there anyway. So it's hard to just say, okay, and then just hope for the best. Who knows who's on the board 2 years from now, 4 years, 6, whatever. But as things go down the road, you just never know. And if it just could set a landslide of problems. And
Dr. Cartwright, I agree with you. And you may find that strange what I'm about to say here, but I completely agree with you. And you highlight it sounds like you're thinking about like a framework around some deficiency of like how it would be cured. Am I reading that correctly?
Yeah, whereas if it was ever to be, if it was built in, but it's just nothing's there.
Right. So that's the point of where we as a board step in, because again, I'm a public member. What you just said sounds really reasonable and really descriptive and sounds like something that I could get behind. That's where the section 3 of this rule, the council may approve or deny a petition under this subsection. In the case of approval, may condition the approval on reasonable terms and conditions designed to ensure the applicant's education, training, and experience provide reasonable assurance that the applicant has the knowledge and skills necessary for entry-level practice as a licensed psychologist. That what you just described sounds like exactly what we're looking for. And when we would go outside and approve something on some narrow circumstance, it sounds like
Let me ask a question.
guardrails.
You want, John? It's a logistical question. So let's just talk about what would the process be for requesting a waiver? Like, what would they have to do? Like, let's say this rule was, somebody wanted to use this rule. They thought they had an issue. Obviously, it would come to us, we deny it. But what would something, I feel like something would help, like a formalized process where how it comes to us and in what rule, and then their explanation of what they think. You know what I'm talking about, Daryl? Does that make sense?
Yeah, I understand what you're saying. You don't want to get too detailed in how you lay that out. Number one, honestly, that's a council function, not a board function.
Okay.
Y'all get to design or say what the standards for licensure criteria are, but the council gets to dictate the process for how it's processed and all that. Now, it would need to come to y'all. However that process goes, it's gonna have to flow to you, because the council's not going to do it. This board is. I mean, really what I'm envisioning is when they submit their request for licensure, they're going to have to, which means they're already a PLP, already practicing under supervision. You're already going to know what their supervisor thinks. They are not going to be able to submit this prior to becoming a PLP because we'll only accept this from applicants. So they're going to submit this request. It's going to be brought to you, and y'all are going to, we're going to bring them here before you. And just like we've done with applicants in the past who had some sort of deficiency or problem, you guys are going to get a chance to question them. We will have gathered information from them. And then you're going to have to decide. And it's, you're going to have to decide, well, do we think, do we think they've manufactured the situation? Did they really do everything they could to try to avoid the situation? Or were they just taking the easy road and hoped they come in after the fact and kind of sneak in? I get those concerns. I get them, but that's why we have the 9 of you, kind of your BS meters running, so that y'all can catch that.
Technical term.
Yeah. That's been recorded for posterity, but
that's important to know, Daryl, like how this would play out, like logistically in real life. We have this rule written down in words, okay, people public comments, but what does it mean in terms of how we would address it, how we would work through it? Because I think the fear, there's a lot of fear going on, is partly confusion about how this would even work, hard to even conceptualize it or in somebody's mind, because we haven't even discussed that yet.
Doesn't it go exactly like this? We've got a denial appeal in front of us and we would sit here and argue about it and say, no, I think we should let them in. No, they shouldn't be in because X, Y, and Z. And no, this is a risk and they should do this or that and the other and jump through this hoop. And we argue about it. And I feel like we've done this in for some reason, there was other cases that we had discretion on either letting somebody in or not. And it's debated and decided with a lot of good ideas.
I'm just wondering, to Dr. Cartwright's point, this is where I was getting at with compromise, because I think that there's misattribution going on strongly on both sides of this argument. And we're starting to spin in circles. I hear that too. But I am wondering if it is time to sort of vote on this, and perhaps I'm just going to put it out there. Perhaps we dispose of where we are at right now, and we look at altering the language of this to put very specific parameters about what we would entertain as part of this rule, and being very specific in what we would entertain as part of this rule under a waiver and modification. Because what I heard Dr. Cartwright suggest is something that sounds very specific in what are the levels of, not in the remediation piece of it, which by the way was where all of this started, was with the concept of remediation and not waivers, which I am totally behind. But I think in talking about what are the level of deficiencies that we would even entertain a waiver for. And I think, or that we would entertain discussing remediation around. Because I think the unintentional consequence of how openly this is written is why there is so much fear around this rule. Is there are a lot of unintentional consequences to entertaining the rule as it's written. And I don't know how other people feel about that.
I think the problem is, for me, in going in that direction, is this section, I think, in my opinion, is intentionally open-ended because it gives the board the ability to make those judgment calls rather than to lay out a bunch of black and white circumstances within the text of it. And again, in my experience, the board has erred heavily on the side of caution and has been more likely to reject some of those circumstances. So I think if we get to the point where we start lining out, okay, this is what's allowed, this is what's not allowed. Well, okay, we have a situation that technically is allowed, but okay, we have problems with it. Or technically, you know, we've allowed this in the past, but now we have problems with it. I think at that point, it's just creating text for the sake of creating text. Personally, again, no one might agree with this. Some people might agree with this. I like the idea that it's open-ended because of the way that historically we have erred on the side of caution and have had a very short leash with items like this.
I think the problem is that you have to create something in writing that lives beyond all of us here, because there is obviously this rule will stay in place long after all of us serve in this position that we currently serve in. And so currently that might be the case. I think the problem is if you have such an open-ended process that it, in a way, it makes it, it invites many people to petition the board for extenuating circumstances. And one thing that I think it's important for us to consider is the board, perhaps, you know, maybe if we go this route and start thinking about how do we rewrite this or how do we work this rule, and maybe this is the way it's written now is certainly not a way that we could adopt it, but perhaps we can modify it to a degree. And part of that might be certainly creating very specific criteria for under what circumstances would you be eligible to apply for some sort of remediation or something along those lines. And that way, I think it would reduce a lot of backlog for the board to be able to consider and kind of narrow down some of that criteria.
Dr. Lambden, anybody can appeal once they apply, and when they're denied, anybody can appeal that denial to the board as it stands. And
right. The problem though, John, is that right now the criteria are very specific, and that's where the goalpost is for applicants right now. And we're going to change a little bit the goalpost about who is eligible even to submit an application to the board and the kind of training they've received.
No, we're not. No, we're not changing that.
Well, we kind of are, because we're reducing the number of, I mean, there's, like I said, there's criteria that are in terms of the quality. So for example, we would consider reducing from 50% time where a supervisor might be on site to 25%.
We're not doing
that's
that.
Just one example.
No, we're not doing that. I'm not sure where you're getting that from, but we're not doing any of that.
Well, isn't that kind of where the rule was, the way it was written in the register?
No, the only thing that's being changed or proposed change in the rule is the underlined text at the bottom. That's the additional language that's being proposed. All the other text that's not underlined, that's the existing rule.
Gotcha.
Yeah.
Okay, thank you.
The standard is still the standard. And the standard would be denied if somebody doesn't fit the box as written today, or no matter what happens on this rule. The standard is the standard. What we're debating is what happens when they didn't pass the standard. And if it is something that's narrow outside, I mean, they still have to have the 1,500 hours on either side. If they met that, then we can have a discussion. And that's all that this rule does, is we can have a discussion. And by history and by tradition and by my estimation for the future of this board, just based on this discussion, the answer is probably going to be no. And that's okay. But the point is, at least it gives us a framework to have the discussion, because there've been a lot of good ideas I've heard from Dr. Singh, Dr. Cartwright, specifically talking about like, what are the things that we would do? You don't even get to have that discussion if you vote down this rule.
I will also say that Illinois and Minnesota are worded to allow for a greater, they're not, if you look at how their rules are worded, they're similar in that they don't hem you into just very narrow categories. They're written much more broadly, like this rule is written.
In my opinion, if, I actually do agree on some level with, I think Dr. Cartwright might have said it about lining out specific cases, in the text. I agree with that to a point. If we had something like, I feel like something like that would be better served as a internal document or as an internal memo or set of guidelines, rather than a part of the rule change, because I feel like specific situations are going to change on a constant basis. I think for future boards, regardless of makeup, I think, those don't set precedents, but you look back at those to guide future decisions, right? We've done that before with the ISC hearings, where, we might rule differently on something a second time, but we will look back at prior cases and see how we ruled before. That would be a separate conversation. I don't think that necessarily belongs in the rule, but it might be a separate conversation to have at a later date.
Well, the first time there's been silence, it sounds like everyone's had their piece.
I'll make a motion if we're entertaining that.
There's no further discussion. I guess just to close, I want to just, whatever, I don't know what's about to happen, but what I want to say, thank you to everybody who commented on it. I think a lot of the comment in terms of trying to protect the internship is important. I can tell you from my perspective that I think the internship is important as well. I do think in elements of this big, broad, awesome state of ours, there are structural problems. And I believe that may have been the word, was it structural, that the word that TPA used? No, I don't know. They didn't use that. Anyways, the acknowledgement that it's hard to meet these internship requirements across the state and every place that needs help, I think is important to note. I think that this rule would allow us some discretion, and then based on this discussion, if we ever did get denial appeals in the future, if it passed, I think the answer would often be no. I think it's important, though, regardless of the facts of the case that precipitated this rule, I think it highlights the fact that we need a rule like this so that we can address things to get people who are qualified to practice out there serving the mental health needs of Texans. So there's been a good discussion. Obviously, there's a lot of passionate opinions on it. So with that, I will entertain a motion.
I'll make a motion.
So moved by Mr. Bridges. What's your motion, sir?
Motion to approve text as written.
All right, it's been moved to approve the rule as written. Is there a second?
I second it.
Seconded by Mr. Adler. I'm gonna go ahead and just call the roll on this one. And you can just vote by aye or no. Mr. Adler?
Aye.
Dr. Becker?
No.
Mr. Bridges?
Aye.
Dr. Calhoun? Dr. Calhoun?
Sorry, no.
No. Dr. Cartwright?
No.
Dr. Lambden?
No.
Dr. Singh?
No.
Mr. Zagouras?
Aye.
The noes have it. The motion fails. Well, I don't know where we go from here, but
Now, well, I mean, the rule is still pending, so somebody's going to have to make a motion to withdraw it.
I'll make a motion to withdraw it.
I second it.
been moved by Dr. Becker. Seconded by Dr. Singh. All those in favor signify by saying aye.
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 All opposed, say
Aye.
no.
Aye.
And the ayes have it. It is withdrawn.
I'll report to the council, and then the council will, they'll take your recommendation, and then they'll vote to probably withdraw it. I feel like that's what they'll do. So that will be at the February 1st meeting is when that will take place.
Let's go do, I guess we're gonna do the next rule.
Yeah.
Personal problems, 465-13. Daryl, will you lay this out for us, please?
Sure. This is a rule that it's actually been problematic for this board for 11 years. We've been working on it for a long time. This is a rule that we had sent up to the council. It came back. We worked with TPA on this language, and I think everybody's happy on it. We didn't get any comments on it. We did all the stakeholder input and everything beforehand, so I think we're good to go. I think we just need y'all to vote to recommend adoption at the council.
Sounds good. Is there any discussion? Take a motion to approve it.
I'd like to move to go ahead and approve this rule.
Been moved by Seguris to approve it.
I'll second it.
Seconded by Becker. All those in favor signify by aye.
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 Opposed, say
Aye.
motion carries. Thank you. All right, let's go. Let me take a break real quick before we come back to 6. Maybe 10-minute break. Are we ready to keep going?
I would love a break.
All right, let's take a break.
I
10-minute
think
break.
it's healthy.
We'll
What time do we come back?
be back at 20 till, so at 1:40 we will be back.
Okay.
All right, it is 1:42 and we're back. We have 1, 2, 3, 4, 5. Okay, yep, we've got a quorum. So we're ready to go. So being done with rules, we're gonna go back to number 6 applications. It's gonna bring up Stanley. Dr. Stanley's been before us for a while now. Daryl, do you want to lay that out for us real quick?
I better let Patrick or John, they're going to be a little more familiar with it.
Yes, Dr. Stanley originally came before us for an application. She was denied under 22 TAC 46311 D2 because under Big B, there was not a clearly designated staff psychologist who is responsible for the integrity and quality of the program. Big C, the internship agency must have 2 or more full-time licensed psychologists on the staff as primary supervisors. And Big I, the internship agency must have a minimum of 2 full-time equivalent interns at the internship level of training during applicants' training and period. The counsel, Ken Dalrymple for Ms. Stanley, is here if anyone has any questions.
Do
How many meetings have we had? When did you say she was originally denied, John? What meeting?
It's been about 3 meetings.
Yeah, this is the 4th or 5th.
I think this is the third. I'm not sure.
No, this is the 4th or 5th.
Okay.
Yeah.
So the whole reason that rule that we just voted down was proposed was because we looked at this and said, it seemed to be, if we didn't think she was qualified then, the idea would have been that we probably would have just denied it. there was enough discussion on the board to say, is there something here that we could do, which is essentially what spurred the rule that we just voted down. So I'm not sure where that leaves us at this point with this, because the discretion that we would have to make any sort of anything that we would want to do additionally for Dr. Stanley, I'm not sure where we would look to for that.
She was denied in December, and the first meeting that we saw her was on February 11th, 2021.
We're almost 12 months in. So my understanding is actually, yeah, let's get, is Kenda available?
Kenda?
I'm right here. Thank you. Can you hear me?
Yes, Ms. Dalrymple, how are you today?
I'm just fine. Thank you.
I want to give you a chance to just lay this out real briefly. I did want to understand just kind of right now, what is Dr. Stanley doing in practice, and what would, and any implications you can tell us of what voting this down or figuring out something else, what that looks like for you.
Well, Dr. Stanley has been licensed as a provisionally licensed psychologist since 2018. And she has been working as a PLP under supervision since 2018. Her PLP expires in September of 2022. Dr. Stanley has had a very successful practice over the last 20 to 25 years. She is a PhD level LPC, and she is a licensed sex offender treatment provider. She's also a gubernatorial appointee to the Council on Sex Offender Treatment. So she, like all of you, has been appointed by the governor to serve the people of the state of Texas. We're not really sure what this is going to do in terms of Dr. Stanley's practice. Clearly, if the proposed rule did not pass, then it doesn't seem to me that the board has any option but to deny her licensure, her application. I would make a request that if that seems to be the case, I would like to have the opportunity for her to withdraw her application if she so chooses, because a denial of an application is a reportable event to the National Practitioner Data Bank. Am I wrong, Daryl?
In this case, we wouldn't report it. It can be, yes, it can be. We wouldn't report it because it was failure to meet the licensing criteria.
Got it.
So we wouldn't report her.
You know,
But
she practices.
Kenda, I'm sorry, I apologize for interrupting. If she were to apply someplace else, though, they might ask her, regardless of what it's reportable in PDB, they might ask her, have you ever been denied? And then she would have to say yes. So.
Oh no, she'll have to say yes.
Yeah.
So this will be something that she deals with in the short term on several different levels. Dr. Stanley has always practiced at a very high level. She's a very bright woman, very hard worker, very dynamic. And this whole process, and especially some of the comments that have been made, have been pretty difficult for her to handle because she's felt pretty attacked. I think that's a pretty good way to describe it. If you all have specific questions about her or her practice, let me know. Just, I did want to bring to your kind of attention that she's been providing psychological services for nigh on to 4 years, and has in list till next September on her PLP. So any fears about how the practice of psychology is going to go down the tubes in Texas, because if she practices, is sort of baseless, because she's been practicing under supervision. And you know, there have been no complaints, no issues, no problems, no questions by the judges in Angelina County. and the majority of the work that she does under her PLP, it tends to be forensic because there's such a dearth in that area. If if there are specific questions, we're more than happy to answer. This has been a quite an eye-opener. The lip service that is paid to providing access to care and to services, psychological services specifically, to people in the state of Texas, is something that everybody talks about, but it doesn't appear that there's that much interest in really doing. The people in East Texas, people that don't live in Austin, Dallas, Fort Worth, the majority of the places where a lot of these comments came from, and the people in Angelina County who don't really have telehealth as an option because they literally don't own a computer and they don't have internet access. This is all going to sound very hollow when Dr. Stanley has to go back and say to the judges that rely on her and to the clients that she has that she's not going to be able to help them with their case. She's not going to be able to take this appointment. She'll be able to do a certain amount, but there is a big difference between practice as an LPC and practice as a psychologist. I don't have to tell all of you that, you know that. And we were very hopeful that there would be a way for any actual deficiency to be remedied, but in deciding to vote down that rule, that's really off the table. So there's frankly no option for her in terms of pursuing a license. The entire experience has been extremely disappointing to her on a lot of levels, not personal, professional. And, if you have specific questions, we're here to answer them. She's on the line, she's available. So that's really all I have to say.
Anybody have questions for Ms. Dalrymple or for Dr. Stanley?
I have one. Ms. Stanley, Dr. Stanley, are you willing or able to, apparently the only way you can fix this is by going back to school or respecialization. Do you feel able or willing to pursue that?
You may have to unmute her.
Yeah, Dr. Stanley's muted. Can we unmute her? Hang on, Dr. Stanley.
I think she has.
Dr. Stanley might be muted.
I believe she is.
We might not be able to unmute her. But there, wait, there we go.
Can you hear me?
Yes.
Okay, I'm here. I'm here.
Thank you.
First of all, I would like to say that I appreciate every single person's comments that were made today. I can hear in each one of those comments the passion that they have for their beliefs and the standards. And I can assure you that whether practicing as a PLP or whether practicing as an LPC or LSOTP, I am just as committed to holding those standards near and dear for the people in Texas, have been from the very beginning. To address your question, sir, I don't rule out anything. I've worked for a very, very long time and have overcome many, many, many obstacles to be right here, right now. I think my biggest concern in this matter is looking back, and this may be something for future discussion, because if this is where it ends for me, I feel like I would hope that you would hear me say that as a student in a psychology program relying on the supposed expertise of my advisor 10 years ago. There was nothing on that. There was nothing on that website back then about this not being a track toward licensure. The second thing is there were questions on the forms at the PLP stage that asked about what program I went to and was it an APA accredited? And my answer was no, because my integrity is on the line and I'm going to be honest about that. And so I was granted a PLP anyway. And so I set my motions in order to go and to do what I had to do, the supervision, the jurisprudence, and through COVID and the whole 9 yards, and pass the same test that any other person would have to have passed to secure licensing. And it wasn't until the end, whenever I found out that this was a deficit. So the questions at the end of the process are somewhat different than they are at the beginning. And I can assure you, I would never have invested that much time, money, or energy, and certainly not have drawn this kind of attention to myself had I known that all of that was going to occur. So I'm not ruling out anything when it comes to finishing this process. I would have to say that, you know, it would have to depend on my life circumstances, but what I would be open to hear suggestions. I'm not faulting anyone. I'm simply saying this is where we are. This is where I am. And when we hang up from this Zoom call, my life will change significantly because of forms from the process, because of things perhaps maybe I should have looked into more closely, and also because of discrepancies or differences in what is asked of me at the end of a program or the end of the PLP or the process or whatever, versus at the beginning. So I am simply here as someone who, quite honestly, I feel a little beat up over this. I don't apologize for asking to be considered for licensure. I have every bit of respect for every program that was represented here today. I'm a member of the TPA. I'm a member of APA. You know, I stand before you as a colleague and not as someone who believes in substandard care. So with that said, I will answer a definitive yes if this board can propose a route that I can take. I am not going to rule it out.
I have a question, Mrs. Stanley, and I know this has been very difficult for you. I'm sorry.
Dr. Stanley.
I'm sorry. I know that this process has been very difficult for you, Dr. Stanley, but I just wonder if you have ever reached out to the psychology program at UT Health Science Center, which is probably what's almost 50 miles away from you, to perhaps remediate or to address those things that you that have been problematic in you getting your license.
I appreciate the question, Ms. Calhoun, but it is
Dr. Calhoun.
I'm sorry, I didn't say that before. Dr. Calhoun. Dr. Calhoun, it's unrealistic to, you know, getting into a PhD program is a process within itself. And so I'm not at that point. This has been a continual, perpetual process. And, you know, I'm trying to get closure on it as well as some of you probably are. And I live in Lufkin, and the programs around that we have. I know Sam Houston does have a psychology program and so forth, but I don't know what it would take to get in, to jump into a middle, to cherry pick certain things and do a pre-doctoral internship at a facility as is described by some of those here today. So I mean, you know, I guess the answer simply would be no, I have not. I have not.
To be clear,
I
there's
just thought
nothing.
that it might be a consideration. Thank you.
To be fair to Dr. Stanley, there is nothing she can do to remediate those deficiencies or deficits. She would have to go get another doctoral degree or complete a respecialization program. We will not accept an internship. Y'all have just said that we are not going to accept any kind of remediation like that.
Any other questions? Dr. Stanley, I just want to say thank you for putting up with us through this process. I know it's been a long road over the past year, bringing you back to meetings. And I want to thank you for being available today. Let me ask you this, actually, I do have one question. If the board voted to deny your application, which I'm not sure what other option we have at this moment, what would that mean for you immediately in terms of the services that you're delivering? I've heard different people ask the question that they weren't sure what difference would be made in terms of the services that you were offering based on this license or not. Can you elaborate for us on what the difference will be on the services and the way that you serve Angelina County?
Yes, I would not be able to provide psychologicals on children who are being assessed for placement. I would not be able to provide the psychologicals on juvenile probation clients. I would not be able to do competency or NGRI assessments. I would not be able to participate or to take any referrals for psychologicals associated with school referrals or doing psychologicals that are or psychologicals that are like other assessments that have to do with just testing, cognitive type things, that referrals through some of the facilities here. I mean, I would not be able to do any of those things. I can do a mental health evaluation, but it is not the same. There are contracts that you know that I have been asked to do. Their referral sources in probably 9 different counties. We get people here from probably 9 different counties. Nacogdoches is one, and I mean, Angelina's probably are 2 of the bigger ones, but in those very small rural areas, the probation departments who need these psychologicals done for further services, I would not be able to take care of that either. And particularly also in the forensic stuff that I've done, you know, there's I know under my LSOTP I can do assessments and of that sort of thing, but where there's non-sexual cases and you know, even with custody with family law attorneys, those kinds of things. And so with much of my practice representing the forensic area, it would leave in a vast void.
Yeah. Just offhand, I looked it up on the Department of State Health Services website. Angelina County shows 2020 licensed psychologists total is 5. I can't always see if there's people that are actively practicing or not. That's just the licenses that are there. Do you have people that you can refer this stuff to?
Well, 2 or 3 of them are retiring. There's 2 that I know of, but they stay away from forensics. They don't like forensics. And so I guess I'll have to look into that. that's what it sounds like. So.
Any other questions?
From me?
No, I'm sorry. I'm asking the
Oh.
board. Yeah, we talked a lot about this and a lot of ideas. I was just making sure that no one else had any questions. It doesn't sound like we do. Again, thank you for your time. Thank you for being available to answer the questions to both you and Ms. Dalrymple. All right. Is there any discussion?
Little disillusioned that there's no method for her to pursue.
Yeah, I hope y'all can hear me.
Going back and
You know, just thinking about Dr. Stanley and some of the services that she.
That was Dr. Landon. Hang on, Dr. Landon. We lost her for a second.
Can you hear me now?
I think we got you now.
Okay. Well, what I wanted to say is just listening to Dr. Stanley and some of the services that she provides, you know, just adhering currently to her situation. I know Dr. Cartwright had suggested some modifications in a future goal. And you know, I know that we've discussed the problems with internet and, you know, obviously I'm experiencing some of the similar issues now, but, you know, I know during COVID, there were exceptions.
Can't hear you, Dr.
As far
Landon.
as
Hang on, Dr. Landon.
supervision, not being face-to-face. And I wonder specific that we might consider super internet.
Dr. Landon, I heard something about COVID was the last thing that I heard clearly.
With the supervision. Sorry. Can you hear me?
We can try now. I got
okay. Supervision, not being face-to-face. To consider this rule, not. Sorry.
Dr. Landon, can you hear us?
Can you hear me?
Yes.
Is that better?
I think so. The last thing I heard was something about COVID, and it was
okay. So yes, I said that there were exceptions during COVID, you know, with face-to-face supervision made for interns and accruing hours that would count towards licensure. And so I wonder if we would consider when we go ahead and move forward, and if we choose to, author another sort of rule proposal in the future, that we might consider in certain extenuating circumstances, this possibly qualifying as one of those, depending on what the criteria would be, that we would consider for certain rural areas, changing the requirement or modifying it to some degree, and accepting internet-based or Zoom-based supervision sessions.
We already do that. We treat Zoom or synchronous audio visual as face-to-face. That's already the law.
So in this particular situation, I mean, obviously, you know, it's very specific for this particular candidate, Dr. Stanley, to find somebody that does forensic work that she could find as a supervisor. And this is just a suggestion for us to consider going forward when we think about, you know, how we want to rewrite or consider rewriting this rule, what we would allow, for example, for her in her particular case, that would also be of assistance to people in her similar situation.
We could, I mean, frankly, we could do that today. We could absolutely do that today if we wanted to. That's within our power to do. We would reconsider the last rule, and we would come back to this and actually put that. We come up with it. We could do it right now, or we could do that. That is absolutely within our power right now. I think it's a great idea.
Yeah, and I would be willing to do that. Yeah, I'd be willing to do that, rewriting the rule. But, you know, honestly, I don't know that we could do a well thought out rule and identify very specific criteria, given the ramifications of doing this in a way that somehow we get it wrong.
Okay.
And we
Like an
can't
example would be-
rewrite a rule without public comment.
No, I'm not suggesting rewriting the rule. I'm saying that we could reconsider the last vote that we took, and then we could actually put constraints on Dr. Stanley or some other thing that we wanted Dr. Stanley to do. That's within our power today to do that. It does not seem to be the will of the board at this moment. But the suggestion was made that we could do something for Dr. Stanley. We could still do that today. But again,
I don't think that we can change an entire rule for one person. And I feel very deeply for Dr. Stanley. I do. And I have listened to her case 3 times, and I have felt very differently about this case previously. And I struggle a lot with the situation that she is in, because I don't think it's fair. But at the same time, I am not sure that this rule that has been put in front of us is the right way to resolve this case, nor do I think that opening this door moving forward is the right choice. And I think that we have already voted on that, moved past it, and I don't know that going back to that is the right way to go.
Why hasn't anybody come up with any alternatives then? If everybody felt like this was not a good solution, why have we not? Because everything I've heard is, no, we don't like that. But nobody's offered an alternative, which tells me that it's very different.
Daryl. Yeah. I mean, there's the option of respecialization, which already exists. But I think that Dr. Cartwright has some ideas around, at least that's what I heard, was a little bit narrower of a band to put on this that might offer some specific intention around modification versus waiver.
I think that the thing about this discussion that I'm having a hard time with is that we're sitting here, you know, most of us are from generally urban areas. All of us have access to mental health care if we wanted it. And what we're sitting here doing is we're talking about an abstract where somebody, you know, in a county in East Texas is not going to have services based on the fact that we want to keep thinking about this longer term, when we've, again, had this rule on the books. This case has been before us for a year. And again, we haven't come up with any other better alternatives. And I do believe on the brain power on this board, we can absolutely come up with some sort of framework for Dr. Stanley to practice safely without being a risk to the public. But it appears we don't want to. That's what I'm at a complete loss right now. That again, for all the brain power here, that we can't come up with a way for Dr. Stanley to practice.
I have a question. You know, you keep saying that without really researching that there is no mental, you assume that there is very little mental health per service available. I was just Googling, there are 12 psychologists in that area.
There are 5 licensed in Angelina County.
In Lufkin area, that rural area. And I am representing rural area, and San Angelo serves 100-mile radius rural areas. And there are no psychologists in little towns, but they come to San Angelo. Or the psychologists go, some people go, you know, once a week or something, some places. But it's not that there are people that are not getting any services. It's that there could be more. And just because one case that it's there are 2 different issues are focusing on how to improve rural services statewide, not just rural areas, statewide is one issue, but another is what kind of applicants should be allowed to get licensed. So it seems to me like you're confusing the issues with some kind of emotions, and I feel for Dr. Stanley very much. And but all the arguments that the professionals have given, associations have given, my profession, this state of Texas, I've taken everything into consideration, and that's how I made my decision of voting as I did, not based on any emotions or any information that sometimes it just gets, oh, there's no mental health available in rural Texas, and then it becomes such a statement that nobody checks and see which rural Texas, where, and how, and all that. And we are doing very well in our areas. But I think we need to keep the two issues separate. We have Dr. Stanley's case that was totally based, in my mind, on fulfilling the requirements of the board. And then second case is, how do we proceed about better, making the rules better to that where it's not misinterpreted, where more and more incoming students, new people that are coming into the mental health, they're clear as to what they need to do. Those kind of things we need to be focusing. And our major focus is public. I did not get on this board to protect psychologists from public or how to get my psychologist friends' licenses. I got on this board with one mission: how to serve the state of Texas better, or how to protect the public of Texas from incompetent services or servers, or services, people who are ill-trained and doing things that they shouldn't be doing under certain, so-called therapy titles. And those kind of the things that led me to this board. And correct me, and I'm always learning, because I'm not that much experience on the board as some of you are. But I feel like for the last few times that I have been on the board, it's been, the emphasis has been on the professionals or the people who are seeking license, then how it's going to impact the public, how it's going to impact the profession, how it's going to, that kind of thing. I have not seen.
Dr. Singh, do you believe Dr. Stanley is unsafe or unqualified?
What did you say? Say it again.
Do you believe that Dr. Stanley is unqualified or unsafe, or I think you said like using titles that they shouldn't be using? Do you think that that's the case in this circumstance?
No, I think she's doing good job doing the services that she's doing under a couple of licenses already. And she's actually doing, she can do lots of those services under those. And what she's been doing, she wants to do, which she has tried to do 3-4 years under the new license. My understanding is, with rare exceptions, most of them can be done through her current licensure.
She did just testify that there are certain things, though, things that she's working on.
But there are other psychologists to do that. In our city, there is only one forensic psychologist, and he meets the needs for that. We don't need, there are many services that are not so widely needed in rural areas that there are than the other services. So it's just like you don't need a kidney transplant or kidney specialist in every basic city, but you do need a general practitioner in every city. So that kind of thing. So there are services that are very specialized that they can be sought if somebody needed to seek them.
Dr. Stanley just raised her hand. Can we let her see what that's about real quick? Dr. Stanley, you're on mute still.
Okay.
There we go. Did you have
Okay.
a quick question?
Yes, I just had a brief comment.
Go back and forth too much, but I wanted to see what you had to say.
Thank you very much. I wanted to clarify that the psychological services that I offer outside of those other 2 licenses directly impact our communities. We have, just in our mental health caseloads, we have 100 people on our waiting list. And even people who work for me, who have tried to get in with other therapists, they have like 60 to 100 people on a waiting list. So I didn't want to mislead the board in that that the only work that I do is in the forensic field. It is far-reaching, the work that I do into all kinds of different communities. And if anything, our areas in the rural communities are some of the lowest socioeconomically classified communities around. And we are officially, both on the federal and the state level, classified as underserved based on those things. So I just wanted to offer a little bit of clarification. If there was a framework that this board could create that I could follow, whether it was being supervised on webcam, whatever I would need to do, I would be amenable to that. Most of everything I've needed to do was behind me. And had I known that, well, I've already said that, I don't need to say it again. So I'm back to where I was before. If there is a framework by which I could finish this process and do what I need to do for the people in our community, then I would be happy to do that.
Thank you, Dr. Stanley. Okay, I know this has been a long meeting. I feel like we're definitely giving this the attention it deserves. Is there anything that has not been discussed that people want to put on the record or bring up at this point?
Yeah, I'd like to say something. I've been thinking about this for the past couple of minutes because it keeps coming up about protection of the public and our responsibility to the public to be sure that psychologists are duly qualified, that they can be practicing in the fields that they're practicing in. And obviously I agree with that, but I think something that doesn't get said often enough is that protection of the public also has an aspect of access to psychological services, especially in rural areas with lower populations. You know, I'm sitting in downtown Houston in a city and a county that could have its own GDP. I went to college in Walker County, which has a whole bunch of unincorporated areas around it, and services in many cases just aren't available in areas like that, or it's limited to 1 per 10,000, 1 per 20,000. So I just want it going on the record that I feel like that isn't said enough, that our duty to protect the public in Texas also extends to access to psychological services in Texas. And I 1000% think that falls under our purview.
Also just want to really quickly say that I appreciate Dr. Stanley being here today and for speaking her mind and speaking her case. And I genuinely feel for her. And I've talked a lot today about unintentional consequences. And I think that Dr. Stanley too is an exception to the rule, in that I don't know that there are many people who come to the board or come to their practice who have as much experience and forethought and training and education under their belts without sort of checking all, to go back to the expressions we've been using all day, I's dotted and T's crossed, as Dr. Stanley does. And so she really falls into that exception category. The challenge that I have as a board member is opening the door and setting up a rule to meet one person's need that then has an unintended consequence for our larger profession that then could have a whole set of impacts to our profession that I am woefully concerned about, that we heard expressed over and over and over again. And I don't know, I think that the access to care for this one spot with this one person in this one area, it's real and I hear it, but this is not how we impact access to care. That is an advocacy and a legislature issue and not necessarily a board rule issue. I think that there are ways to look at some of the board things that we do that may or may not be impacting access to care. And so I do have concerns about that. And I just want to acknowledge that I hear that.
Dr. Becker, I think you raised some really good points there. And I really very heartily agree with just about everything you said there. The one thing that I wanted to cue in on is that you mentioned that the legislature, what role does the legislature have in this? The legislature plays a role in a lot of things, and the legislature essentially is driving it. They own the bus. Right now, they've given us the keys. We have 2 members of the legislature that essentially said, please fix this. And if we don't do something about it here when we have the chance to do it, and the vote was close enough that any one person who voted against this could actually be the deciding factor in doing this or not. We have the opportunity right now to fix this. And I, again, one of the points that I most wholeheartedly agree with you about is the unintended consequence thing of what are the unintended consequences of us taking action on something. I will tell you from my experience on the board is that most of the rules that we are making were to correct an exception, to correct an outlier that we discovered. And one of them specifically was that I was involved in was the sexual harassment rule, because there was an unintended consequence of how the rule was written that didn't allow us to do what needed to be done. And we had to change the rule. And so that's, again, this situation here. There's an unintended consequence that is excluding, I believe, a qualified individual from practicing. And it's our job as the board, when we find that, to correct it and correct it with constraints. And what we didn't do in the construction of this rule is let it go willy-nilly. There's still some pretty good guardrails on there, especially guarding the internship. But just to come back, I really agree with you with unintended consequences. Freakonomics is one of my favorite books, and it's a book just all about unintended consequences. So I hear you, and I'm completely with you with making sure that we're not creating problems accidentally.
Mr. Chair, could I add something from a rule perspective?
Please.
The one thing I would say is there is a difference between all the rules and how they're written. And one of the things that you'll notice is there's never an LSSP brought before the board that didn't meet certain requirements. And I think there's really a specific reason for that, is because of the way that rule is written. The way that the rule is written that allows people to qualify for LSSPs is what I would call Frankensteining their requirements. It actually allows them to complete the degree and then continue to add additional credit hours to meet the requirements under the rule. So just because somebody didn't finish it under their degree program doesn't automatically exclude them from it. Unlike the LPA rule and the LP rule, the 46311 rule, where it specifically states you have to complete your formal internship within your doctoral degree program. So if you don't complete an internship that meets all the requirements of the rule, if it wasn't APA accredited, the only other option is, as Dr. Becker pointed out, a respecialization program. Now, the problem with that is I've spoken with the licensing manager and I've asked her, have you ever had anybody that got denied to go through a respecialization program? And her honest answer, I haven't asked her recently, but I've spoken to her about it before. No, we've never had anybody come through that. And the problem with that is APA only accredits about 7. There's none in Texas. They're all in New York or California. I think there's one in Pennsylvania and maybe Hawaii. So it's a possibility that they could use that to cure it. But I mean, it's a lot of extra schooling to go through to fix their deficiencies. So there are ways in the rules that we allow certain things, but again, I mean, I may be talking about apples and oranges with the different license types, but there are ways that people meet those standards in different ways. And I don't think there's a public protection problem with the LSSPs that we license.
So might there be something that we could do with the respecialization? Trying to think through this really hard. Is there a way that we could look at the way that the respecialization stuff is written, where we could go down this road of something here that could be helpful?
You don't
We
have
wanna go-
control over respecialization programs.
Oh, okay, that's an APA thing, or that's something else.
Yeah, we don't have any control
Trying
over those
here.
programs.
Okay, I'm trying really hard. We're 5 hours into this and I'm working hard at it.
But we were talking earlier about you have people's lives in your hand when you're in an ISC. Y'all got somebody's life in your hand right here. Say again?
Going back to the original conversation on this, I mean, this is the point I was making with leaving something that was intentionally broad in the body of the language, and then internally deciding, not codified in the language, but internally deciding, okay, these are the kind of situations, because like it's been said, this is a 1 in a million situation that, like, this is the first time this has come up, at least in the time that I've been on the board, something like this. But that's exactly where I think the broad scope of that additional language needs to exist, is to contemplate something like that. And I think the guardrails are in place internally on the board to where this is not going to be something that would be abused. I don't buy that argument. I don't think it's something that would even come up, but every once in, like I said, I've been here 3 years, haven't seen something like this. So who knows, once a decade maybe. But when something like this comes up, then we have the ability to at least look at it. And that's the only thing that's the problem that I have, is the self-limiting part where we don't even have the ability to look at it. And now we say, okay, well, she's presented and yeah, this is great. This is unfortunate that she's going through this. What can we do to help her? Well, we have the capacity to help her, like we could have the capacity to help someone else down the road. And I think we're limiting ourselves to not being able to do that. I 100,000% understand the concerns about unintended consequences, but I think the way that we fix that is have the language in there and then internally decide over time, okay, these are the kinds of situations where we're going to allow this. This is where we're not going to allow this. And I think most of the time, 99.9% of the time, this board's going to err on the side of not allowing exceptions to the rules. I don't see this becoming a long-term issue of letting everybody in regardless of what they've done. So
here's the other thing, is that since recently we voted to have this be the minutes of our meeting, this is the record. I mean, it's not even, if you think about things that are just written minutes and things, the nuance and discussions that happen, that would not have been the record. This is the official record of how you're deciding things. And there is no, I think there's zero doubt that that we don't want to let the floodgates open here. That there's no doubt on that for everything that has been said today. So just to echo Ryan there. The way that we can do this, we have a couple of options before us, and I would invite Daryl or Patrick or John to chime in if there's any other. You guys have far better legal mind than me. We have a couple options. One, we don't really have, based on the rules that we just voted on, we don't really have an option of moving to approve Dr. Stanley under any circumstance with guardrails, with additional restrictions or everything. We have no option to do that. Unless we just want to go willy-nilly off the rails and do it, which I don't think that's a good idea either. That was part of the rule of why we were proposing it. So that would leave us with a motion to deny, and that's just the end of it. There is another one, and if we wanted to reopen the rule, we could vote on the rule again and then figure out what guardrails we wanted to put on Dr. Stanley. But the way I see it, those are kind of our three options. Daryl or Patrick or John, do you have a fourth option, or do you think have I laid it out as well as?
That's it. That's it. Those are your choices.
Those are the options. So really it's deny, or if we wanted to do something else, we could.
So what are options from this point on? So how do we go forward?
We can either move, someone can make a motion to deny, because we do not have the authority to do anything. To approve it, we can't approve it with guardrails. We can't do any sort of modification as it stands. If there was a motion to reconsider the vote on the rule, and if the vote went a different way, we could then take a vote on either approving Stanley with guidelines or additional requirements or something. There were five doctors. There's 5 doctors who could on this board that I'm sure could come up with something that we could all agree with. But those are our options right now, based on where we sit.
I have to move to deny her application.
All right, it's been moved to deny the application. Is there a second?
Wait, real quick question.
Yes.
Can I have?
Yes.
I did have one thought. There was a conversation, and Daryl, this might be a question for you. There was a conversation about it coming up that she had an application denied versus allowing her to withdraw her application.
Yes.
Is there the ability to table the motion to allow her time to withdraw it before the next meeting? Or is that even?
Don't table anything. This is drug on long enough.
Okay.
What you can do is condition the denial on, say, if you haven't withdrawn it within 30 days, it will be denied.
Okay. That was my biggest thing, was if we're going to go this route, allowing her to withdraw.
Absolutely. So let me revise to say, I'd like to move for a conditional denial.
Move for conditional denial by Dr. Becker. Is there a second?
Yes, I second that motion.
It's been seconded by Dr. Lambden. All right. So the motion is conditional denial, been moved and seconded. I'm going to do a roll call. Mr. Adler, how do you vote?
Yay.
Dr. Becker?
Aye.
Mr. Bridges?
Nay.
Dr. Calhoun?
Aye.
Dr. Cartwright?
Aye.
Dr. Landon?
Aye.
Dr. Singh?
Aye.
Mr. Zaguris? Mr. Zaguris?
You're muted.
I said nay.
All right, the ayes have it. The application is conditionally denied.
Staff will get the letter out to her now after the meeting.
Thank you. I'm obviously disappointed with that outcome. I think that's a tragedy for Angelina County. I think that the board has, unfortunately here, I think that no one has been willing to say that Dr. Stanley is unqualified. No one has been willing to say that Dr. Stanley would be a danger to the public. And I'm disappointed that that we didn't do something in this case, because that is our power that we have. We don't have a lot of power, but we do have the power to right some wrongs. And
She's not unqualified, John. We're not saying that she's unqualified. We're saying that the rule as it's written is not the remedy for it.
No, y'all said she was unqualified.
Okay, Dr. Becker, we just
Hold on.
the application.
If denying her application doesn't say she's unqualified, then what does it say?
It says that she doesn't meet the qualifications of the standards as they are written by our state.
Then that's the point, is that we can, as a board, we can be the judge of being qualified or not. And the board decided her not to be qualified today. And I'm disappointed in that. So we can obviously see it differently. I'm obviously in the minority here, but I'm disappointed that we didn't take the opportunity to make it right and to provide some framework that we could have done for her. So moving on. I think we're on section 8. discussion on temporary license requirements. Daryl, are you gonna tee us up on this?
This is the issue that we brought up at the last board meeting. The way the temporary licensure rule is currently worded, in order to practice under that, before you actually practice in Texas with a temporary license, you have to submit an email or something in writing to us and get approval saying this is the date I'm going to practice on. It's incredibly time intensive for staff to track that and have to deal with it. So we made some suggestions to the rule committee or to the board last time. The board really didn't kind of like the way we had suggested to go, so they kicked it over to the rules committee. And what you see here is the solution that the rules committee came up with to try and tackle the administrative burden that the current rule is putting on staff. The one, for the most part, it accomplishes kind of like what we were after, the administrative efficiencies we were after initially. The one thing I would point out that is a pretty significant departure from how the current rule operates is that last paragraph, where it now imposes the condition that you cannot, not only must you be in good standing, which is a statutory requirement, but the rule goes beyond that and says you cannot have had any disciplinary action within the past 10 years. So that's an additional requirement that had not existed in the rule before. I think the rationale for that, and Dr. Becker, you correct me if I'm wrong, but the rationale for that was, look, these are individuals that aren't going through the full vetting process. Therefore, we don't really know, we don't get as an extensive background of them as we would a full applicant. And so that's kind of the rationale for that in there. I will say it is something that's added that hasn't been in the rule before, though.
And I think we made the addendum to either go back 10 years or to provide that background thing that we require of our applicants.
The
So it
NPDB
was an
self-query.
either or, right?
Well,
Mhm,
no,
the
I mean,
self-query, thank you.
the 10 years is there. But it's just if they can't provide documentation from the other licensing authority, then
Oh,
they can
got it.
submit the self-query report in lieu of that. But the 10 years is there regardless.
We ready to go to the next one? Or do we need an action or?
Well, you really need an action on this one.
Do we just need a motion to adopt?
Yeah, vote to propose it up to the council.
Okay.
Can we restate the proposal real quick?
Well, you would be voting to propose these changes to our temporary licensing rule to the council. Now, I'll tell y'all, one of the things we're going to look at the council level is why we have this additional requirement in the rule now, because it is going to have it's got a little bit of an anti-competitive tinge to it.
If they're in good standing, it's not just enough that they're in good standing is what we're saying, correct?
Correct. Yeah, under this proposal, that's correct. You must not have had any disciplinary history for the previous 10 years.
But they can practice wherever else they are, correct?
Yeah, they're in good standing. They're already in good standing, or otherwise they wouldn't even qualify for the license. I
don't understand why we're making an additional requirement just for temporary licensure on that. That's what if they got there's lots of things people get a wrist slap for, but they're still, it's small enough that they continue to practice. If it's just temporary in Texas.
Yeah, for example, if you got, we don't do it anymore, but if you had a CE administrative penalty or reprimand for some sort of CE violation, that would knock you out of being able to be eligible for a temporary license here in Texas. If it fell within that 10-year window. We got the 10-year window from the rules of evidence that basically say you can't impeach somebody for a felony conviction that occurred more than 10 years ago, is where we came up with that 10-year requirement.
I get it if we're worried about somebody who's like some egregious sexual violation or something like that. But if there was some egregious sexual violation, you would assume that if they got sanctioned for it, they wouldn't be still practicing if it was as bad as it actually was. I mean,
Yeah, if you're still on probation or suspended, if you're still under any kind of restriction, then you're not going to be in good standing and you wouldn't be eligible for the
so
license.
it's just them anyways. We're talking about people who
Yeah.
truly and are in the clear.
This is for people who this would catch people who, although they had gotten in trouble in the past, are now in good standing. In other words, their home state jurisdiction has said, no, we've removed all restrictions. You're good to go again. You can practice unrestricted again. But if they tried to come here and get a temporary license, we would say no, because you had some sort of disciplinary history within a 10-year window, even though you're currently in good standing. And that's where you're going to have to have a discussion at the council and probably the governor's office on this. Because it makes no distinction between major, minor violations. I get the rationale for it. I understand that, but
is there a way to segregate major and minor violations on this? Because obviously, like, we would be concerned if there was a major violation, but for somebody who got popped for CE credits, not being able to practice in Texas temporarily, that doesn't sound like.
I think when Ron proposed this, because this was something that Dr. Palomares brought to the table. I think his big concern, and maybe one of you guys can correct me if I'm wrong, because I'm a little fuzzy at this point. I believe his concern was someone who was sort of under investigation, who would still be in good standing, but would actually would still be able to practice, but would be reported as good standing.
I think
that's not accurate.
I think that's close to the way I remember what Dr. Palomares was saying. I think his concern was regular applicants will have to get fingerprinted. Temporary applicants don't get fingerprinted. And so currently we wouldn't be able to deny an application for a regular license just on an arrest. They would have to have a conviction. But his concern is they're not doing those other. I think that's his rationale. If I can put words in his mouth, was they're not getting fingerprinted. So he wanted some other guardrails. Is that right, Daryl?
The problem is criminal history is different from what we're talking about here. We're talking about administrative actions against the license. We absolutely cannot deny somebody based on an arrest. So that's a no-go. That's a hard no. What I'm remembering is, I guess now that Dr. Becker brought that up, is if somebody were under investigation for some sort of administrative infraction in Missouri. The problem with that is we're never going to know it. Because Missouri, most jurisdictions, I'm not aware of one that isn't like this. Most are not going to reveal an ongoing investigation. They're only going to share with you the results of a final investigation. That's how we are. That's how every jurisdiction that I don't know of another jurisdiction that does it differently. So you're never going to know that. If that was what his concern was, it's a misnomer. It's out of place. It's not going to address what he's wanting. I think
what I'm remembering, but I just don't know if I'm accurate.
Yeah.
My memory, not what
I remember the criminal history. I do remember him talking about the criminal history.
I'm sensitive to any sort of like restraint of trade thing. There better be a very big, glaring, and real reason that we can point to very quickly as to why we can't. I understand. Go ahead.
Well, I was going to say, what you're going to get faced with is you're going to say, look, have you had any problems? Y'all been operating with your temporary rule like this for decades now, with just relying on good standing. Have you had any problems? No. Why are you changing it? You know, what's your reason for changing it? And then you're also going to face, especially in a world now where mobility is such at the forefront of everybody's vision and what they're looking at. You've now put an additional burden on mobility. And the whole point behind temporary licensure is to be quick so that you can come in, do your evaluation and go home, or come in, treat Susie who's here at UT, and you're done for that day. You've now made it more difficult to do that. And so I can see the council and the governor's office having some questions along those lines.
So we need to, we're relying on good standing right now. The only change to be the 10-year thing?
Well, there's some other changes
Wrote
in
some
there.
other language.
Yeah, there's some other change. The other changes really address the administrative problems that we're having at the staff level about having to check off and approve people before they actually practice in the state. That last paragraph was something that was separate and apart. It was added on. It was a totally different discussion that got added on.
Yeah, the major changes in subsection F, where we used to require them to get pre-approval before they used one of the 30 days. And now they're just submitting, after they've completed the 30 days, they're reporting those 30 days to us in a one-time basis, as opposed to emailing Diane 30 times over and over again, and then emailing her and saying, oh, I didn't use that. Let me take that one back.
The idea being that the burden for the documentation would be on the licensee and not on our staff. And so once they report the dates that they are using their temporary license, we then have a record of it. And should there be an issue later on, we would then have dates to match up. So if someone is here and they reported that they used their dates from October the 10th to October the 15th, and then a complaint comes in that there was a court date that they were involved in, please leave my office. If there was a complaint that came in on October the 22nd, and they did not report that date within the board, then that would be an issue with our cross auditing, that we would know that they shouldn't be involved, that that was not a date that they had filed with the board, that they were licensed to practice in our state. And so that was really the thinking, that the onus would go back on the licensee and not be with our board to have to file all of these things and know when it is. That once in the calendar year, the temporary licensee would have to file all the dates within those 30 days that they were practicing in the state.
I don't have a whole lot of strong opinions on this either way, other than that I'd prefer to see that if you're in good standing, you're good to go. I think there's less problems there. That's just me though. Do you need a motion, Daryl, on this?
Yeah, I mean, this is just like proposing a rule. So y'all would have to make a motion. There'd have to be a second, and then you'd vote on it. And this is a recommendation from the Rules Committee, so y'all can, I mean, you don't have to vote on it today.
Here, right?
Yes.
Yeah.
You're
So-
the board. The Rules Committee just gives you a recommendation. So
So how the motion has to be stated?
if you want to send the rule up as it's written, just say, I move that we propose this rule to the council.
Okay, I move that we propose this rule to the council.
It's been moved, it's been proposed. Is there a second?
Second.
Been seconded by Dr. Calhoun. All those in favor signify by saying aye.
Aye.
All opposed say no. The ayes have it. So let's get it proposed. Thank you very much. 10. Daryl, do you have that too?
Yeah, there is nothing here. This was a rule that when we started the discussion on that 46311, because we had an LPA that had a similar issue, we visited about, do we want to look at creating a similar rule for LPAs? And so y'all kicked that over to the Rules Committee, but the Rules Committee declined to, they decided not to recommend any kind of a rule change in that regard. So we have nothing there.
Any recommendations for future agenda items from the floor?
Let me just ask a question, Daryl. So that applicant we discussed last time with the LPA and before and after the demarcation where there was more qualifications, more specific. So what happened with that applicant is that nothing we can do there? Is that what I'm hearing?
No, y'all already voted to approve that applicant.
Okay. All right. All right.
Yes, sir.
Okay.
All right. If there are any items that you want to see on the agenda, either get with me or staff if you think of something that we need to talk
There's
about.
one thing.
Oh, yep.
What about new committee assignments and what's going on with that? Or do we want to elect a vice chair also?
That will be probably the next meeting. I'm going to work on that. That's
We also need a representative for BHEC.
right.
Ron was a back. Oh, yeah, that's right. Dr. Fletcher.
Right.
Professional.
Yep. So we're going to work on that too for the next meeting as well.
All right.
Is there a BHEC meeting prior to our next meeting?
Yes, February 1st is the next BHEC meeting. So
So I don't know that we can wait on that.
you'll have to decide if you want to have an interim meeting in the meantime. You can't decide it here today because it's not on the agenda.
So I think we kind of have to have an interim meeting because I don't think it's a good idea to let the BHEC meeting go without representation.
I agree.
Duly noted.
We do an interim meeting right after this meeting?
No, no, it would have to, you can't do it that way.
A for effort, though.
It's too simple.
Not unless we all want to go to jail, and I don't, so.
Really? That's what we're looking at?
Not on my list this week.
Work on that meeting that Open Meetings Act training, that stuff.
Okay.
All right. With that, the agenda is clear. I would entertain a motion to adjourn.
Motion. Adjourn.
Seconded.
And without objection, see you next time. Thank you, guys.
Thank you.
Have a good one.
Thanks, everyone.
Bye, y'all.
Everyone.